And thank you for joining us this morning for our City Council budget session. We'll go ahead and get started. Connie, could you please call the roll?
Cheatham.
Here.
Lurick.
Here.
Mangum.
Here.
Mansfield. Marchand.
Here.
Nichols.
Here.
Black.
Here. Thank you. We'll go ahead and move to agenda item number 2 is community organization budget request. Representatives from community organizations will be present to regarding fiscal year 2024 allocation requests.
Honorable Mayor and City Council, it's Gene Hill with the Finance Department. I have Bonnie with me here. And to start off, we're going to turn the time over for 10 minutes for presentation to BJ with the Aid for Friends, and then 5 minutes for Q&A.
Wonderful. Thank you, Jean. Good morning, everyone. Wow, Monday morning, you're right into the budgets? I'm impressed. I'm BJ Stensland. I'm the Executive Director at Aid for Friends. And in April, we submitted our request for annual allocation along with other nonprofits. And we've asked for the past 10, 12 years for about $8,000. So you received that formal request for that annual allocation. And then we were asked to provide a PowerPoint. And so what I've done, all of the information that I've gleaned is in our annual report. I'm going to give you some statistics. I'm going to go over very briefly some of our programs, our services, and talk about our values and our impact on our community. And then I'll ask or answer any questions that you may have. So the first slide, I'm not good at this PowerPoint thing, by the way. So the first slide actually sums up exactly what Aid for Friends has done last year. All of these statistics are for 2022. No. Just leave it right. I'll be in charge. Oh, sorry, Jean.
You're fine.
Last year, our total number of people served was over 1,800 people. And that goes across the board for our different programs. The annual report is slightly different than some of the statistics I provided in our request for allocation, only because this is more current and it covered that period of time. Okay, now we're going on. The emergency shelter, which is our new, ooh, how cool, is been in operation since July of 2021. So it's almost been 2 years of the new shelter. And of that, we've had almost 400 people last year in 2022 come in and get services. That's over 12,000, almost 13,000 bed nights. And we've served that many meals to people, including people that come that aren't staying at the shelter, but also need to have an evening meal. So we open the doors. This new facility, if you have not seen it, please talk to me. I would be more than happy to take you on a tour. You need to see it. It is that significant, and it's that uplifting, and it's just a beautiful, beautiful facility. So please ask me anytime. I'd be glad to take you on a tour. We had over 30% of our people come in were families. And these numbers have shifted. We used to see 80-85% single men. Our numbers are changing, and our number of single women, that is, I want to talk to everybody. That's our biggest change over the past, I've been with Aid for Friends 25 years, and that's what I'm seeing are shifts. It's women and families. And the men's numbers stay the same, but now we're getting more of those others. So we've had, most people stay about 27 days. They can actually stay 180 days based on how long of a period they stay. It's 90-day period, and then they're asked to leave for another 90 days. Okay. Well, let's see, I like that. But our emergency shelter isn't our only service. Aid for Friends has expanded over the years, and we have other housing programs. I just want you to know, I took these pictures. These are pictures of our houses that we have spread out in Pocatello. We actually have 5 locations, and these are 3 of them that we own and that are used for permanent supportive housing. We have 24 clients currently. Last year were staying at permanent supportive housing. The most vulnerable are those that qualify there, chronically homeless with a disabling condition. Then we have these other housing programs, one's for for homeless prevention. That's if you're in the imminent risk of losing housing by eviction. And then our rapid rehousing programs have been available for people that are literally homeless but are trying to get quickly back into our community, into rental. We won't go into the need of more affordable rental housing, but it's huge. We have people at the shelter that are able to do everything they're supposed to, but they can't find housing that they can afford. We need to address that. And then the COVID, that was last year. We're not going to be able to have that anymore. We've closed out that grant. So those 92 people that were housed, we're going to have 92 people that aren't housed this year. So think about that and think about our need for affordable, accessible housing. Our other programs, how neat. We are designated our region's access point for HUD. And this is HUD's concept of instead of people going to many, many different locations to try to find out if they qualify for HUD assistance, they can come and get one assessment at one location. What we're finding as this program's evolving, and Jessica Buckley's the coordinator or the manager of that program, we're finding that a lot of it is diversion. We need to be able to help people find other options because, again, housing is right now, we don't have a lot of funding for it. We do have some Bannock County. How am I doing on time? Anybody got do you have your timer,
You
Mayor?
have 10 minutes and you've used 7 of it.
Oh, cool. I'll keep going. All right. So
Got
we
3,
have
so-
Bannock County. I still have 7?
3.
Oh,
3 minutes.
come on. All right. Bannock County also provides some housing, and that helps us with people that may not qualify for HUD housing or assistance. They might just make a little bit too much or may not have that eviction notice. But that's available, and it really fills a beautiful gap. And then we are a clearinghouse coordinator for the Portneuf Valley Interfaith Fellowship Urgent Funds that help people with different needs that hopefully aren't continuous, that there's a sudden need, maybe a need to get to a doctor's appointment, prescriptions, some medical, or maybe utility assistance. All right, I'm going to stop now. In a minute and a half, I wanted to share with you, and I didn't get it on my PowerPoint because I thought of it afterwards. I just want to talk to you about Aid for Friends values. And we created this as a staff, and I'm going to read them very quickly. It's in our vision statement, in our values. Homelessness does not define a person's character or ability. It does not have to be a permanent condition unless it's a chosen lifestyle. Providing services not only assists the individual or family, but it also improves community by lessening the impact that homelessness generates. Each person deserves to be treated with courtesy and respect in an atmosphere free from threat or neglect. And finally, efficient management of human and financial resources is essential to produce quality services to the most people. Pretty cool. And then we can look at our financial overview. This is slightly different than what you may have seen in the application. I bumped up the costs of the emergency shelter, put a little more buffer in there. But actually, our shelter is about a fourth of all of our programs. The other programs pretty much get paid or reimbursed by HUD, but our shelter, we only get $38,000 out of that 208 from federal funding for, from the Emergency Solutions Grant. And the benefit that we have, it costs us $10, $15 per person to house and feed people. And it costs $75, $100 or more to keep them up in a hotel. We used to put down there what it cost to put somebody in jail, and I realized what a wrong thing that was. Just because you're homeless doesn't equate you with being in jail. But that, at one time, that was the only thing we had, the only place we had to help people if it wasn't the shelter. But now we have some other opportunities. But now it's the cost. So we're very cost effective.
I think you're out of time for Q&A.
Okay, and we have a bunch of staff that we love and they're very dear, and without our staffing, that's the most important thing that we have. Our biggest asset are our staff. And we love them and they're dedicated, and I'm ready to answer any questions.
Council, any questions? Okay, we've got Council Member Nichols and then Council President Cheatham.
Hi, I have two questions. So do you work with the other agencies to help people like get out of homelessness to help solve the problem?
That's what our coordinated entry, our access point does. We have case conferencing once a month. And I can also tell you this community works better than any community I've ever seen in working in a collaborative way to help people. So yes, there's other housing providers that if they have an opening, we meet with them. That's what Jessica does. And so we spread it out as much as we can with other agencies and other programs and work together as a team. You bet.
All right, and my second question is, so I'm presuming you have a mix of like a transient population versus sort of a local population, is that right?
You know, that's a interesting thing. We used to, 25 years ago, when it was easier to get on the railway and get across Idaho or go through Montana, we had a large transient population. But now that is not the case. 85% of the clients that we're serving are from this area, and that means Pocatello is large, and Bannock County. So it's our local people.
Got it.
And then we're open. If somebody needs help, if they get stranded here in Pocatello, we're available to them too.
Thank you.
Council President Cheatham.
Mr. Mayor, my question may be better for the Finance Department, if that's appropriate at this
Okay,
time.
sure.
Looking at the financial support page in this PowerPoint, there's two numbers in a lot of these categories. You go down to City of Pocatello funding, 8,000, then 8,000. Government funding other cities, 0, 1,000. I'm wondering why there's two numbers in each of those categories. And it's true across the board in virtually every presentation.
It could be the way, excuse me.
Are you talking about on the application or in the deck?
It's in it says Community Agency Request for Financial Support, Finance Department.
It's in the application. I wondered that too. It's right here. And it shows government funding.
Double numbers.
I believe it was the amount that they received
in the prior
Prior
year.
year.
Yeah, and then
So-
their new requests.
Okay, so that's last year and this year?
Correct.
All right, thank you.
Thanks.
Okay, any other questions? Okay, thank you. We kept
Thank you very
BJ
much.
a lot quicker than I thought we would, quite frankly. It was,
I can spend more
I know,
time.
I know.
would love to
we'll
talk to
move
you.
on though.
Thank you so much.
Thank you. College Neighborhood Association's up next.
I thought we might be going last. It was at the end of the list, but that's fine.
Oh, it was on the,
Under C.
Yeah, I know. Under the email, it was last.
So
Okay.
this is Sarah, right? No?
No, this is Meg Holmes.
Oh,
So, my name is Meg Holmes. I was just voted in as co-president of the College Neighborhood Association. I've been on the board for only 2 years. Trissa Cameron was the president, so.
okay.
Oh, Trissa Cameron was the president before me. She was supposed to be here today, but she couldn't be here, so here I am. I will do my very best to represent our wonderful organization. I have a few notes on my phone, so I hope you don't mind if I look at my phone a little bit. It's looking at my notes. So do I just
Yeah,
scroll?
just scroll.
Okay. So a little bit about the College Neighborhood Association. It's been around for 30 years. It represents the University Neighborhood Historic District, and it's recognized by the State and National Register of Historic Places since 1984. So I think it's important to note the mission of the association. That's to preserve the historic character of the homes and neighborhood and foster community within the neighborhood.
There you go.
So in order to foster community, we try to have a few events a year to build our community so we can get to know our neighbors and help each other. I think under Trissa's presidency, she's done such a good job of coming up with great ideas. And one of those was the Light the Caldwell Park event, which we had our first one last year. What's cool about this is they have lit the park in previous years. We got a ton of lights, string lights from a grant. And the deal with the city was our neighborhood would put lights up the trees as far as we could reach, and then the city would come in and do the higher parts of the trees. So this year we did that. We tried to have families sponsor a tree and come out one day in November, so early enough before the snow fell. It was a really cold day, but we still had a lot of support, and people, groups like NHS came out and helped too. So we did our part that day, and then the city came out later and did the rest. And then we planned this Light Caldwell Park event. And our vision was kind of like, those Hallmark movies at Christmas time where, the whole community comes to the square and they turn on the lights and there's Santa and music and all that. And honestly, it was exactly that. It was a beautiful event. We had a horse-drawn carriage that people would ride around our neighborhood, and some of the homes were already lit up. It was really, really pretty. We had a hot chocolate bar and fresh donuts. And of course, Santa came in on the sleigh at one point and had a meet and greet with all the kids there. There were also, I think if I go up, so you can see the horses. So that's the sleigh. And then we got approval from the fire department to have little bonfires throughout. It was really cold that night, so everyone was kind of huddled around the bonfires. One community member's only job was to man the fires, so that was his role, Brian Meesh. And then this is going to be, hopefully it's okay, this is pretty quick, but there will be time for questions. So a little bit about the budget. You can see the Project Neighborly Grant funded 100% of last year's event. We don't know if that's available again this year. It's not listed as being something that is an option for us this year. We spent $3,175 last year on the event. with the largest purchases being the horse-drawn wagon, the colored flyers to distribute through the neighborhood, and the donuts. Potentially another fee could be the music. We did have live music too, but that was donated to us from the band. And this year, we'd like to request funds from the city. We'd like to increase our budget to $4,500 to allow for larger quantities of donuts and hot chocolate because we ran out. We ended up having 350 people come to the event, which was more than what we had imagined. We were really surprised and grateful for that turnout. And then any other incidentals that we didn't have the budget for to make it even better, and maybe even invite other neighborhoods in the community to participate in as well. I think that's it. Oh, there's our, yep. Do you need to see this too?
They have it.
We have that. So, okay.
Mr. Mayor?
We have a question.
Yeah,
Linda.
there's just I think a little discrepancy in the slide where you had the budget. The narrative, it said 4,500 was the ask, but in the application it says 4.
Oh,
I was just wondering which one's correct.
Trissa did talk to me about that. I think that she was advised, I'm not sure by whom, to give it a little bit more of a cushion. So it's an estimate. So, I mean, I don't know. Like I said, there's incidentals and there's things that we'd like to do to make it better. So maybe it's to account for those things. I don't know, honestly. I mean, I can ask Trissa.
Yes.
But what is your request, 4,000 or 4,500?
45.
Okay.
Yeah.
Okay. Other questions for Meg? All right. Meg, thank you.
Thank
very
you.
much. So now we have Family Services from Sarah.
Good morning. Thank you. Okay, thank you. Good morning. My name is Sarah, and I work for Family Services Alliance, which is the organization here in Pocatello that serves victims of domestic and sexual violence. We provide services to victims of stalking, and then also secondary survivors of homicide and suicide. And so, first and foremost, we're really here to say thank you. We, as a social service organization, I think that we cannot do our work without the support of our city partners and our friends in law enforcement and also our other social service organizations. You know, one of the questions that you asked was, do social service organizations work together? Absolutely. And so I am here to, number one, say thank you for your ongoing support and your past support, and then here to talk about what we hope for in the coming year and what we plan to do for victims of domestic and sexual violence. So I'm going to move to slide 2. Oh,
That's fine.
make it a little easier.
Either way.
And so I wanted to talk a little bit about what the core of our services really is about. We, as an organization, believe that safety is paramount. So anytime an advocate responds on site with a local law enforcement officer or responds on site to the emergency department with a victim of sexual violence, or they go to someone's home, or they even come here. Sometimes we end up in the hallway of the police department late at night as someone's entering our emergency shelter. Our number one goal is for the person that we interact with or the family that we interact with to walk away from that interaction safer, to have some tools, to have some skills, to have some resources to become safer and to be safer in our community. We also have the responsibility to really empower our survivors and help them find their independence and what safety looks like for them, and also teach healing and coping skills. So as an organization across the state and across the nation, you'll see domestic and sexual violence organizations. All of them will have a crisis hotline. We have a 24-hour crisis hotline that we're able to respond through dispatch to local issues around crime, but also we see a responsibility to provide long-term hope and provide counseling services, provide play therapy for kiddos who've been exposed to violence in their homes, make sure that we're offering folks the opportunity to heal from what has happened to them and to learn coping skills to thrive in this community. So let's move to slide 3. We sort of break our program into two groups. We have 2 teams. Our advocates are sort of our on-the-ground folks. Their offices tend to be the backs of their cars, and they spend a lot of time at the courthouse. They spend a lot of the time in people's homes. They spend a lot of time at other social service organizations. Their goal is to help people focus on increasing their physical safety. So that looks like emergency shelter. Similar but different to Aid for Friends, because I think one thing that Pocatello does really well is not duplicate services. So our shelter is specific to survivors who are fleeing. It's an imminent danger situation, and they're fleeing maybe in the middle of the night from their home to the emergency shelter. Our advocates also spend a lot of time at the hospital, a lot of time at the Bannock County Courthouse, assisting folks with civil protection orders, assisting folks modify no contact orders or ensure that they're ready to testify against their offender. Helping people prepare for that court process is really critical. And then we move towards counseling services also. So again, like I shared before, we feel it's really important to not only provide advocacy, not only provide crisis intervention, but also provide something for later. And so all of our counselors are trained in what's called EMDR, which is a post-traumatic stress evidence-based therapeutic intervention. We provide lots of attachment work between kiddos and non-offending parents. We do a lot of work around feeling in control of your body. When folks have had power taken from them, whether they've been strangled, whether they've been sexually assaulted, whether they've been kicked, their body has been taken from them. Their power has been taken from them. And so we spend a lot of time helping folks get back to feeling in control of their bodies. And I see it's about 4:45, so I'm going to stop and ask for questions.
We still have 4 minutes.
Oh, I thought I had 5 minutes to talk and then 5 minutes for questions. Oh my gosh, I'm trying to follow the rules and then I broke the rules. Oh my gosh. Okay, well, so I could have slowed down. Okay, sorry guys. I feel nervous now. I felt nervous before, but now I feel really nervous. Okay, well, my name is Sarah and I work for Family Services Alliance. So as I said, we really sort of look at two sort of critical times. Crisis intervention right in the moment, and also long-term support. How can we support folks on their healing journey? How can we help people thrive in this community? And one of my favorite things is when I see people come back and they say, what can I do to support people who are going to be in my situation in the future? I had somebody bring in a jar of peanut butter and said, somebody gave me a food box when I was here. I was at the emergency shelter and I had a box of cereal and I want to give something now. That's incredible to see community members supporting community members. And for victims of domestic and sexual violence especially, the whole job of a domestic violence offender is to make their victim feel less than. And so for city councils, for community members, for folks to come together and say, in fact, you do matter, and this is how we're going to show you that you matter. We're going to ensure that you have access to counseling. We're going to ensure you have access to safety. We're going to ensure that you have access to care. That sends a loud message that they do, in fact, matter. I'm open to questions.
Council President Cheatham.
Could you describe your typical demographics?
Sure. So I'll say sure and then no, because really anyone can be affected by domestic and sexual violence.
Who are you? I guess I shouldn't have said typical. I have a picture of who I think you're serving, and I want to know if I'm right.
Sure. So we serve anyone. The majority of our clients are women and women with children. However, that is not all of our clients. So anyone can come into services. Really, anyone who has been affected by domestic or sexual violence or stalking, they qualify for our services. So our clients typically come to us one of two ways. Number one, because they're in crisis right then. Because a law enforcement officer has responded, there's violence in the home that night, and they are seeking some support for what's going on in the moment. The other thing that often happens is people have been in a relationship in the past or have had a negative experience, have had an abusive past, and that's sort of coming up now. So sometimes people walk in our doors and say, I don't really know what's going on with me. I don't really know if I qualify for services. But when I was 19, I was sexually assaulted. I'm now in a relationship that is loving, caring, safe. But when that person touches me, I find myself freezing. I find myself experiencing a lot of fear. I find myself remembering what has happened to me in the past. And so folks can come to us both for what is happening right in the moment, but then also, again, for that sort of healing and those coping skills to help folks work through that. So our demographics don't necessarily look like men or women, older folks or younger folks. They look like folks who have experienced violence in some way. I hope that answers your question.
Define the male versus female.
So all of our data comes to us self-identified. So we have what's called an intake form that we ask all of our clients to fill out, and they tell us if they're over 18. We document that as an adult male, an adult female, or a transgender individual. And then our kiddos also identify as male or female. And so we can break up our data and sort of provide, we served this many kids, we served this many adults, we served this many males. And about, I would say 80 to 90% of our clients are either adults or adult females or children under the age of 18.
Thank you.
Thank you.
Other questions, council?
Mr. Mayor,
Yes.
Yeah.
what is your reach? How far out in Southeast Idaho do you typically?
So we're in a 3-county area. Our main services obviously are in this in sort of this larger population area. But we do have some outreach services in the rural portions of Bannock County, and then also in Caribou County and Power County. So as our world changed with coronavirus, we got better at responding through telehealth systems, which actually sort of helped us as a program because we've always been really housed in Pocatello. We have both our office and our shelter here in Pocatello. And then over the years, we've had various maybe federal grants to help us get out to rural communities. Now we still have a rural grant that helps us get, for instance, to Caribou County or Power County. But we also can do telehealth counseling for folks that are in those communities and reduce barriers around transportation, reduce barriers around even our advocates. You know, that can really suck up a budget, right? Traveling. And so we can help with that. The last time I ran statistics, 85% of our clients reside in the city of Pocatello.
So I have two other questions, if that's
Sure.
right. On the emergency shelter, first question is, what is the typical length of stay or the length of stay that your organization allows?
Mm-hmm.
The second question is, what is the overall capacity of how many people you can keep there at a time?
So to answer your first question, we are really our shelter is different than Aid for Friends, Hispanic Youth Foundation, or SICA. Our shelter is for folks who are right in imminent danger. And so our stay is about 30 days or less. Folks come into the shelter as an absolute last resort. People typically want to use a no contact order or a civil protection order to stay in their homes. And then we're going to work with Jessica from Aid for Friends to help folks get into long-term housing as quickly as possible. So folks stay in the shelter about 30 days or less. It's a shared living situation. We can house of 10 to 12 individuals. And our home is donated by Bannock County, and then we, kind of deal with the upkeep of the home and kind of prepare it for community members. People typically come in high crisis needs. A lot of times 2 o'clock in the morning. A lot of times we're sitting. As I said, we'll be sitting in the waiting area of the police department, filling out some paperwork and helping people get connected to the shelter. And then they're going to the shelter. We have access to clothing and access to sort of the comforts of home. And what I hear from folks is that was the first time I've slept in a long time. So about 10 to 12 individuals can be in the shelter at a time. It's a shared living situation, so that could be more than one family. And then we're going to help people as quickly as possible get back into their homes through a no contact order or civil protection order, or access rapid rehousing or something to get connected to long-term housing. I hope those answer your questions.
Yes, ma'am. Thank you.
Any other questions? Thank you, Sarah.
Yeah, thank you for your time.
Sarah.
Next is the Pocatello Free Clinic. Sherry.
Sherry.
Hi. I'm Sherry Joseph. I'm the Executive Director of the Pocatello Free Clinic. I have been in that position since 2019. Thank you for the opportunity to talk to you about what we do for the city of Pocatello. I'd like to start by saying, the quote is my quote. I truly believe that, and I believe that the city of Pocatello supports this clinic. We're one of the oldest free clinics in the nation. We are 52 years old this year. Most communities either do not have a free clinic, or if they've had one, it's sputtered and started and had to close its doors at various times for lack of funding. And here in our small community, we have never had to do that. Idaho Falls does not have a free clinic. And so, and think about 52 years. It's quite a record, and I'm very proud of it. The mission, and I know mission statements can be dry, but I do feel like we do a very good job of following this mission statement. 75% of our patients are Pocatellans, but we will see anybody in the area that has a need. We are not, we do not discriminate in that way. We really try to prevent disease in our community. We were one of the few free clinics in the nation that kept its doors open during COVID. Most of those clinics closed, and we really saw it as a mission to try to not only decrease COVID in our community, we did tons of testing in our parking lot for free, but also keep patients out of the ER that did not belong there, to keep the ER doors open for people who were truly sick. Education is also a huge part, and I'll speak about that in an upcoming slide. Okay, we're going down memory lane here. I don't know if you guys remember, but we leased this building from the city of Pocatello for $1 a year. Some of you who are new may not realize that. It was the City of Alameda fire station. It was at least 100 years old and kind of crumbling around us. It had a big ramp, which is not in that picture, so we did have wheelchair access. It looked very ADA accessible, but once you got in the front door, there were 5 different levels and nowhere for you to go in that wheelchair. We were very grateful to lease that building for $1 a year. We did a lot of good there. In 2019, we moved next door to the Crisis Center in the building purchased by the Portneuf Health Trust, right across the street from you guys, basically, and share services there with the Crisis Center on one side, and Hope and Recovery has recently moved into the other side. So it's a pretty fluid a pretty fluid marketplace there with patients really going from place to place. And we work very well with the crisis center. Patients come over for any medical need. That's something that does not happen in Idaho Falls as well. Patients are escorted to the ER by a police officer, all at the cost of the city. And here we just walk them over and walk them back. And Hope and Recovery is tied in very nicely, trying to get patients tied into their free services as well. There's a lot of words on this one, but we are a medical home. We meet all the needs of the patient, whether it be psychosocial, physical. We spend 30 to 60 minutes with each patient to try to address the needs. We've recently tied in social work, and that's a lot through working with ISU and using social work students, which are at no cost to the clinic. But now we are addressing much more of those social needs that you all have asked questions about how services tie in. By having a social worker on site, we can send people various places where that care is already established and we don't have to recreate the wheel. We work a lot with trying to get patients on Medicaid. Anybody who we see could qualify but has not done the paperwork, our social workers will sit with them, fill out the paperwork, and send them on their way to Health West, where they can access services through Medicaid. We feel that's truly important, but there is still a gap, and many of you are aware that Medicaid expansion is being rolled back. We have had an increase of number in calls. 50% of our patients are employed, with 75% at less than 100% of federal poverty, which is $12,400 a year for a single person. So doing the math on that, you can see why medical care and especially mental health care, is out of reach for so many of these people. Some of the patients we've seen lately who have been kicked off of Medicaid say, I'm working and I could maybe afford the visit, but I can't afford my medicines. So all medicines are free, and most medicines are given to the patient as they walk out the door. Travel and transportation is a problem for a lot of our patients, and so by handing them the medications as they leave the building, they're much more likely to be compliant. And if we can address these issues with patients when they're smaller problems, your blood pressure's moderately high, you're pre-diabetic, you have a small infection that we can treat right now, we prevent problems from becoming much larger and much more of a burden to either the hospital or the community. We really do try to prevent the spread of communicable disease in our community, and we do that one patient at a time. How am I doing?
Good.
Okay. Oh, I didn't even see. Oh, I got a ticker. Oh my gosh. No wonder she got nervous. Okay. Funding sources. So this is something we have really built up over the past several years by writing more grants. The thing about grants, we love our grants, but anybody in the room here could tell you that grant money does not come for free. It comes with more work. And, you know, I understand that. They want to make sure that their money is going to the appropriate places and being used in the appropriate way. But sometimes you have to hire more people in order to do the work that the grant requires. And a lot of them will say, we'll pay for everything except for your people and your rent. And I'm like, well, those are the largest expenses that we have. You all are aware, I'm sure, that of the cost of medical care, and it just keeps going up despite our best efforts. And so in order to provide this care for free, which lots of times when patients walk in the door, they'll say, it's not really free, right? It can't be free. It is free. We don't charge a dime. But in order to do that, it takes a village, and this is part of the village. We try to fundraise when we can. Bannock County has been very supportive of us for years. The hospital is extremely supportive, the trust. Idaho Health and Welfare is right now our biggest funder, and that's all through grants. And so I've explained what happens with that. And we're, again, very grateful. We also do dental, and I haven't really mentioned that either, but our dental program is rapidly growing, and lots of times by fixing a patient's teeth, you can return them to the workforce. And it may not be something you think about, but it's true. And we've had patients call us and say, I don't need you anymore. My teeth are fixed and I got a job. So it's a great thing. Lots of volunteers. I don't know, how many volunteers do we have? 72 volunteers, I think, in the last 6 months. Our volunteers change rapidly because there are a lot of ISU students who are getting those man hours in order to qualify for the programs down the road that they want to go to. We have a very high track record of our volunteers getting into DO school, MD school, PA school, and I feel like that's part of my job, is to take these students in, expose them to this population, help them care for our patients, and send them on their way a much stronger individual. Studies show that if you expose that student population to caring for this type of client while they're in training, they're much more likely to continue this work as a successful practitioner, and I think that has a lot of value. Every dollar is local, and we stretch them. These girls will tell you, we stretch them. They'll call me and go, "Can I buy a calendar? It's $450." And I'm like, "Yes, you can buy the calendar." So, I mean, and I'm not kidding, we stretch every dollar as far as we possibly can. We take a lot of donations. We have a clothing bank out front. Clients come in and get free clothes. You can't imagine how many clients are like, I just got out of jail. I don't have anything to wear. Warm clothes in the winter are extremely important. 1 minute. Okay. Last slide. So free. And here's the type of care. We have a chiropractor that volunteers. We have an orthopedic surgeon that volunteers 1 day a week. The counseling for mental health, we've added through Amy here, and some students within the last couple years. And I don't know if any of you have tried to get counseling lately in the community. It's expensive. There's a wait list. A lot of them are not even taking insurance. So to be able to offer that to our clients, who a lot of them have a mental health component, the top 3 diagnoses we care for would be diabetes, cardiovascular disease, hypertension, which is a part of that, and mental health. And we have a diabetic educator on site who teaches our clients how to hopefully get off their diabetic medicine. The crisis center patients, the social work is just, again, a huge component. And then the ISU thing I am so proud of. Look at all the different disciplines there. We've added them on kind of one by one through the university and through building strong partnerships, and they really help us extend our services without any additional cost, but yet help us, again, stretch the dollars.
Thank you, Sherry. Questions, council?
Look at,
Just on time.
yes.
Questions?
I do.
I do. You do?
Yeah.
Okay.
So you said you have an orthopedic surgeon and a chiropractor that donate some time.
Yes.
Do you have other local physicians that come in and help out?
Yes, we do. We have, so our staff, currently I have an MD and I have 2 PAs, and everybody is part-time. But we do have the family medicine residents from ISU come in and they donate time. Dr. Joseph comes in and donates time. What else am I
And we
missing?
also have,
Pat Francisco, a nurse practitioner, comes in and donates time.
and we have several local specialists who will donate, like, we'll take one patient every couple of months.
When we have
and
something
can send them
that-
to their office as well.
Or something that really relates to their specialty.
Great. Got it. Thank you.
Any other questions, council?
I would like to ask for an increase in the budget this year. I did not put that in the proposal, but we have been at $10,000 for many years now. We are grateful, but everything does cost more, as you can imagine, and I'd like to ask for $25,000 to help extend our care. We are helping with the homeless problem as well by trying to get our patients tied into housing and to temporary housing. We go out outreach is every other week, excuse me.
Yeah, that's what, a big thing that we do is our medical director is really passionate about going where the people are. And so we have regularly scheduled outreach events where we'll go to Valley Mission, Aid for Friends, Salvation Army, local health fairs, farmers market, Revive at 5, lots of different places, and do on-site health screenings, and then help get people connected to care to try to help prevent chronic diseases from getting worse and making sure that people are connected to their provider.
We got 2 more questions. Corey and then Scott.
You had mentioned, in comparison, Idaho Falls doesn't have a free clinic. How far out are you seeing people coming in to get services?
It's a good question. We have many patients that come from Power County, also Bingham County. We do have some that travel down from Bonneville. We have a few patients from the southern counties. We haven't done as much outreach down there, and travel is hard, right? So we have a new grant that just started with United Way where they are offering rides for our patients. And so we have plans in the future to do some more outreach in the southern counties. But again, predominantly Pocatello.
Thank you.
Okay, I'm just looking at the funding, and maybe I'm looking at it wrong. You got 10,000. Looked like the request here was 20 for this year, but you're
Yeah.
making it 25.
I am.
Okay, so I look at that, and then I look. You say the majority of your funding comes from health and welfare through a grant, and that's gone down.
Through many grants. Yeah, it has gone down because there was a mobile van purchase. So the health and welfare funded a $200,000 one-time purchase of a mobile van. And so that was added into the health and welfare funding for 1 year, as a one-time deal. But our health and welfare grants total are, I don't know, it would have to add it up, probably 300,000.
Yeah, they rotate from when each grant starts and stops.
And then they're constantly changing, and we're always looking to see what will fit with us the best, that will help us the most, and then we don't know if we'll get it.
So when I look at the county funding, is that simply Bannock County, or is that
It is.
Power County doesn't kick in?
We've applied to Power County. We're in the process. And so we have had 2 meetings with Power County officials, and it kind of is in the same process with you all. We're waiting to hear if we'll get some funding. So we have approached them.
Okay, perfect. Thank you.
You're welcome.
Linda.
I just wanted to say, I really like that you have increased your outreach and the philosophy of sort of reaching people where they are. And especially everything that we've just been through with the pandemic and everything, it seems that's more important than ever. And so you hadn't mentioned it, you just did now, but I was going to ask about the mobile outreach van. Is that the main way that you go to different places?
Let you guys talk about that. Amelia is our outreach coordinator. This is Amelia Carrillo.
My name is Emilia Carrillo, and I'm the outreach coordinator for the free clinic. And so I'm mainly the person that's going out there. I've been meeting with a lot of farmers. Rural health is very important, and there are a lot of communities that are isolated because transportation is an issue. So initially I go alone and meet with them and create a relationship and connection with them. And then if they allow us, I'll bring our van out, because if we just bring a van, people are going to be hesitant and they don't really trust. They wouldn't trust us. So first I go out there, meet them, create those connections, and then we bring out the van. And that van can go anywhere.
It's very well equipped. And we do take it to Valley Mission on occasion and to Aid for Friends, because patients can come in and it's just like a medical office. And so it has a bathroom. We can do everything we need to do in the office, and it's great publicity for us. It's very, as you know, it's very well signed and shows kind of people who we are.
And if anyone would like a tour of it, we love to show it off.
Yeah,
So.
and our clinic as
I
well.
have done the tour at the United Way function a couple years, last year. And it's a fabulous van. My other question was about the need for the increase. And I know that there's a couple of reasons for that, but as you mentioned, costs of everything are going up. We know that in every area. But I was also wondering if you could talk a little bit about your fundraisers. I know that you face some challenges with the fundraisers.
Yes.
And in addition to rising costs, that was one of the things
Yes.
that kind of hit you also.
Yes, so fundraisers have been very difficult during COVID, as you know, as everybody knows, and so that really tampered us down for a while. But our major fundraiser is called Rake a Difference, and we rake homes in the Pocatello area for a donation to the clinic. And in 2021, even though it was during COVID, we wore masks when we were around people that we were really worried about. But again, it's mostly an outside event, and we raised about $27,000. It was a lot of money. It's a lot of work. We use a lot of student volunteers. It's a huge coordinated effort, but it really is a community service project. A lot of the lawns we do, people can't rake them themselves. They're older, they're disabled, they're very grateful, and so they give us a donation. So last year, it started snowing, and I think that the final count was about 13,000. So we took a huge hit. We went back in the spring and tried to do a little bit more. But when you've got everyone organized to come out in the fall, it's hard to rally the troops again to come out in the spring. And a lot of the students are graduating and busy, and so it was difficult. And yes, we took a big hit this year.
And one last question, if I can. I had been talking to some people and heard something that you guys were doing, or more that you were doing on building the mental health component, and I just wanted to ask about that as well.
Yes, so I started out as a student getting my master's in social work and providing counseling, and through grants that the Pocatello Free Clinic requested, they were able to hire me part-time as a counselor. And since then, we've also been able to expand the program and then hire 2 additional social workers, bachelor level, to be able to do a lot of this social service connection. And so now we have a capacity of 3 or 4 of us. And then additionally, our medical provider has worked with University of Utah to bring a 4th-year psych resident starting in July, so that we can better meet the needs of more difficult mental health management cases. And we're also going to be opening that up to the community in general, because we do feel that we'll have the capacity to help reduce some of the needs that people are having getting in to see a provider here.
And there is such a need. So it's a psychiatrist in training, basically. He's in the last year of his residency, and there was a cost associated with that, because everything has a cost, and that was $12,000, and the Rotary helped us, Stephen Wigg and the Rotary helped us fundraise, so we have been able to raise that money through Rotary and through the Idaho Community Foundation to pay for that, the cost of that. And then also, besides staff, Amy has also manages the social work students. And so we also have a social work student who provides mental health counseling at master's level. So again, providing that for free. And it's a huge component of keeping a patient well and trying to get them back on track to be successful in the community.
Thank you.
Corey.
So beyond the grants and looking at like the mental health aspect, does the health and welfare provide any funding there? Because I know that they do provide funding for certain mental health agencies and people who are connected to those services. And so is there any avenue for that, or is it strictly because it's the free clinic that it doesn't qualify, or how exactly does that?
Well, we do not have any grants currently through Health and Welfare that fund specifically mental health. Most of our grants through Health and Welfare support specific programs such as chronic disease prevention. So we'll apply for a specific program and like the HIV hepatitis C prevention, but we do not have any current funding specifically for mental health. And that's something we're constantly looking for when they open up applications.
We did write our United Way grant this year. Half of our United Way funding is applied to social work, and which covers mental health. But
not through Health and Welfare.
Okay.
Yes.
Now, and when we talk about, are we talking like PSR, or what specifically are we talking about, like social work?
Not PSR. It would be more like case management. So when a client comes in and meets with a provider, we do social determinants of health screening. So if they screen positive for anything such as food insecurity or unstable housing, then automatically our provider will say, oh, well, would you like to meet with a social worker about that? And so then they'll be able to meet with a social worker, sit down and really look at what all of their needs are. And then that social worker can help connect them with other community resources to help bridge some of those gaps.
The provider was trying to do all this before, and it just, she couldn't do it. There wasn't enough time to do all the medical visit plus that. So she would try, but by adding them, and then they'll spend half an hour to an hour with them. They'll help them apply for Medicaid, because the patient will be like, well, I tried, but I never heard back, or the form's too complicated, or, I'm not sure if I qualify. Well, let's sit down and figure that out, and then we can send them on their way to an FQHC.
Thank you.
Any other questions? Okay, Sherry, thank you.
Thank you.
Next on the list is Sika Catherine.
Good.
Good. All right.
Good morning. I'm Catherine Dye with Sika, and I'm the director of Meals on Wheels. Do you want me to? Okay. So in this, so we serve up to 7 meals a week, 4 days a week. So we only work 4 days a week, so we deliver a frozen option on Wednesday and a frozen option for the weekend. Some of our clients actually don't qualify for weekend meals anymore. We've had a lot of funding cut, and so we've had to scale back to 5 days a week for some of those clients. But the delivery itself is also a safety check. So we do have a lot of children of seniors who want them on the meals, particularly for this welfare check. Last year alone, we had 4 adult protection service cases, and they were on their deathbeds for the most part, and we were able to safely get them removed from those homes through APS. So that welfare check is a huge part of what we do. In 22, last year, we delivered 45,425 meals and 364 unique clients. So a unique client would be, sometimes they go to the hospital and they stop and then they come back. So it's just per client that we served. In this slide too, I'll just point out that 1 in 5 Americans is over 60 right now, but over the next 10 to 20 years, we're gonna see a huge influx in seniors who wanna stay independently living, and that's what we're trying to do, is keep them in their homes to save the system, the Medicaid, the nursing homes. Those costs end up being $80,000 to $90,000 a year, and by keeping them in their homes, we're saving money in those areas. So seniors living alone in Idaho is 22% of Idahoans. So that's a huge number, and we expect that to continue to rise. In Idaho, we're the 6th for social isolation in seniors. So that's telling you how bad social isolation is right now with older disabled persons who live home alone. So in this study, Medicare reimbursements, they decreased significantly when they had Meals on Wheels over a 30, 90, and 180-day stay or continued service. And that's for hospitalization, nursing, and emergency room visits, because we're able to be there in the homes with them. They also saw an improvement in mental health, self-rated health, reductions in falls, improvement in isolation and loneliness, and worrying about being able to stay home, because they really do want to stay in their homes as long as they can. Let's see. There's 32% of those seniors are living with a disability right now, and they are reporting fair to poor health, and that's another 22% of that population. 29% have 4 or more chronic illnesses. Some of these aren't in this slide, but keep going. Let's see, Medicaid spending for nursing facilities in Idaho alone is $131 million. The stay in a hospital is $2,500. Oh yeah, you can see that. And a day in a nursing home is $285. Let me go to this next one. Oh, so on top of the food, we've implemented some more programs to help our seniors, not only for the fundraising in this slide, but also with friendly visits. Excuse me. So this year we started a pet program and a friendly visit program to help with the isolation issues that we have with our seniors, because people who are lonely or isolated don't live long lives. They live longer if they have active communication and socialization. So in the bottom you can see we have robotic animals. I didn't bring any with me because they're a little disruptive, but they're so much fun. And I think Linda and Brian both got to meet them at our 60th anniversary party this year. They are amazing. The cat itself will roll over for belly rubs and it starts purring. And statistically, if you have an animal, you're going to live a longer, healthier life as well, because just petting your animal helps raise those good cortisone levels that keep us healthy. We actually just last week found out we were awarded a $5,000 grant to continue working on our pet program. And so what that looks like to us is food, vet care, litter, treats, things like that, that they are not getting right now. Some of our clients report to us that they're eating half of their meal and feeding the other half to their pets. And so this is really important in my opinion because of their health along with the health of their pets. The robotic animals too don't require food or cleanup. And so it's been a huge asset for our seniors to have that without having the additional care. Their faces light up when they receive one of these too. They're amazing. They follow your voice. They're very interactive. And we just got some birds in. So that's been interesting in our office. They actually go on a walker. They have like a little strap. So as you're walking, it like chirps and sings songs and everything. It's really neat. The friendly visits, when my drivers are done delivering their meals for the day, they're making contact either over the phone or they're going back in the homes with the seniors and doing activities with them that they would normally do at a senior center. But they're not able to get out of their homes. And so we're bringing that value to them in their homes. So far, it's been not well received yet, but it's starting to come along like, no, you're fine. You don't need to come over to my house. But now we're starting to see, after about 6 weeks now of doing this, more people are like, yeah, let's do that. I had so much fun with you last time. So it's been a great program. And then some ways that we have found to find additional funding is sponsoring a vehicle, the one on the left there at the Pony Car Wash. You can see there's logos on the back of our vehicles. We will advertise people's companies for a low donation. So it's about $1,000 to $2,000 a year, but we're driving 40 to 60 miles a day in our community, so people are seeing those vehicles. The one in the middle there is Adopt a Senior. So as you can see, it takes $10 to get a meal and rising to the door. And we pay $6.50 per meal just for the food. So as you can see, the cost is going up significantly recently. Another way that we've raised money is through our CARS donation program. So it's similar to the Idaho Youth Ranch. You can deliver or you can donate your vehicle for a tax deduction. And then we get 80% of the proceeds of the sale of that vehicle back to our program. And that's all I have for Meals on Wheels. Do you guys have any questions for me?
Questions? We've got Council President Cheatham and then...
I need to step out for a few minutes.
Okay.
Be back as quick as I can.
Okay. Councilwoman Lurick, Brent Nichols, and Corey, it sounds like.
At that anniversary that you mentioned, the 60th anniversary celebration, I had the privilege of sitting with several of your drivers, and I was just amazed to hear their stories and the things that they have to say. So it seems to me, I mean, food obviously is very important. It's one of our most basic needs, but also the human contact that they provide. And as you said, for many people, that's their only contact
with anybody.
And so I just, I think that we can't stress enough how important that is as part of your program, and in taking the food to people, they get to do that part as well. So I just think what they do is wonderful and what you do is wonderful. So thank you.
Yes, I try to remind them how amazing they are all the time, but they don't feel that, right? They're the friend of the client. They do become close with them. It's really great.
It's much more than delivering meals, and Brian knows. He went along, and I'm Joe. I'm the new CEO there. I went my first week to go with the drivers, and one of the most humbling experiences ever is just delivering these meals and seeing the connection with the driver. And I mean, they're just the people light up just to see somebody at their door. And
yeah,
it's about the meal, but it's much more than that.
Yeah,
and it's to see the connection is really good. Tried to stay quiet, but I couldn't.
I was surprised
You know my
so
age,
long.
I have issues.
Brent,
Hi. Do
Hi.
you prepare your own meals or do you contract for them?
Yep, we don't have a kitchen right now, so it's contracted currently through Chartwell's at ISU. And it's been actually amazing. The last 6 months, they've done a great job of providing really fresh food and seasonally special food too, so.
And it's, I think, $6.50 a meal. is what
Yep.
they charge us.
And they do medically tailored as well for us. So sometimes we have the gluten-free and the diabetic, and they do help us with that, making sure that they're getting the right food for their nutrition.
Right, nice. So you have 45,000 meals, 364 seniors. That's less than one meal a day per senior, if my arithmetic is correct there. Why isn't that number higher than 45,000, the people coming and going?
Because some people only get 2 meals a week or 3 meals, or it just depends on the clients.
That's by their choice?
Yes. So our biggest funding support is Area Agency on Aging, and their clients have strict guidelines, and they only support 5 meals a week at this point.
So do you ever have an opportunity where somebody would like 5 meals, but for some reason you're just not able to do it for funding
Absolutely.
purposes? And why is that?
Funding. We during COVID, we lost some funding. We did get some back in 2022, but it's dropped again. Also, the meal itself costs $6.50, and we're only getting reimbursed a portion of that from Area Agency. The rest comes from donations and fundraising.
So how big of a problem is it that you have people going hungry because you don't have the money to pay for their meal?
It's a big issue. I mean, to be honest with you, is what we're trying to do is, at the end of the day, trying to, spend out all the money. But there we have clients that would like more than they're getting, but we're at the point where we can only do so much. In fact, this year, the Medicaid would only reimburse us so much. We had to make a decision to push those meals to somebody else because we just couldn't. We've had a $13,000 hit in just our Medicaid.
So what would it take to service the people that are hungry?
More funding.
I know, but
I don't have the dollar.
you don't have a number?
Oh, no, I
I don't have that
don't.
dollar
I'm
figure
sorry. I just know that we could be serving a lot more clients if I had the funding for it. And that would look like bringing back the Medicaid clients, because we were only getting $4 from them per meal. And so it was costing us more to get it to Medicaid clients than we had.
Right, okay, thank you.
We're reimbursed.
thank you. Councilmember Mangum.
So Councilmember Nichols asked most of my questions. But most of my questions all surrounded that exact number, because I did the math also, and I was like, that's a little shaky. But so when it comes to the pet feeding, are we feeding pets per day, or is this just like a huge bag of food and we just drop? Or
And that funding is coming directly from the special grant. This
Yes.
isn't coming from this funding.
Yeah, so
This
the-
funding that's requested is going directly to the meals.
Yeah.
That's a separate grant that we got, just another service that we're offering our clients.
awesome.
We're members of Meals on Wheels of America, and they have special grants throughout the year.
Oh, okay. So now back to the line of questioning that Councilmember Nichols had. So so it is a huge problem to have multiple people going hungry, but are we also at a lack of manpower? If the funding was there, or even currently, is there like a lack of manpower to be able to address those needs?
No, because we use the kitchen at Chartwell's, they're able to accommodate. We're serving nearly 200 meals a day last year, but right now we're around 100 to 120 meals a day. And so they can absolutely hold that and get more meals prepared. And then my drivers, they're done by 12 or 1 o'clock in the afternoon. And that's why we're able to have that time to go back to the homes to visit with them. But if the numbers went up with meal needs, then our drivers would be able to spend more time delivering. That's not an issue. It's just the funding, the money to pay for the meals, really.
Okay.
Other questions? Okay, Catherine, thank you.
Thank you.
Next, we have the Senior Activity Center, Anita.
Hello, good morning. morning, Council. My name is Anita Valadola, and I'm the Director of the Senior Activity Center. And I will wait.
It's all my fault.
Okay, that's okay. A lot of people don't know about the Senior Activity Center. What stems our nutrition and our services is in 1965, President Johnson declared the Older Americans Act. And so as soon as he gets that up, then I'll, oh, it's okay. Do you want me to wait? Okay, in 1965. And so a lot of seniors were not being fed. And so, oh, there we go. There we go. Okay, so we passed, President Johnson passed the Older Americans Act. And basically what that act means is seniors living at home and living independently. What we do is we feed seniors. We're dedicated to feeding the senior population, seniors 60 and older. We also do socialization and nutrition counseling, along with exercise programs, classes, outings, and other opportunities for seniors to take advantage. I do want to know, as far as to be active, I do want to put this, I did put this little logo down here because recently in March, the governor had their nutrition conference, and it was the first nutrition conference in the state of Idaho that all the senior centers got together. And we were one of 6 that was exemplary to, as far as the senior center. So I'm not sure if you guys know that or not, but the governor had stated that we were one of 6 exemplary senior centers. And I think it's because we have the nutrition component and the socialization component together. And so I had the opportunity to talk for 15 minutes, and it was really exciting because, and we had Sika there and other entities, but it was an honor. Our program funding, it's pretty simple. In 2022, our expenses were $287,729, and our income was $302,439.89, and so that left roughly around $20,000-$30,000. So we're not making a lot of money. We're spending everything. And if we do have an extra, if we do have extra money, we just save it. We do have a little cushion money, and we try not to ask you guys for much. We did replace, a couple of years ago, we replaced our heating and cooling unit, and that was a little under $10,000. And we have 5 of them on top of the building, and we've been told that we have to replace the other 4 in the future. So we'll pay for that. And we're not asking for any funding. Oops, let me go back. So we are funded by the Old Americans Act, and our funder is on a federal level. It's Idaho Commission on Aging, Older Americans Act, and then on a state level, it's the Idaho Commission on Aging, and then Sika not Sika, excuse me. I've got Sika on my brain. CCOG. Excuse me, CCOG governs our nutrition grant. But we reach out to local governments. We get $20,000 from Bannock County, and we get $7,500 from City of Chubbuck. And so we also try to do fundraising. We have 2 fundraisers a year, our golf tournament and our car show this last weekend. And thank you for participating, all that came. We also do, we take donations and other sources. Sometimes we're just blessed with a donation and we don't know how we got it, but we make it all happen. I want to say thank you very much for allowing us to be in the building. We pay $1 a year. We're trying to it is an old building. We're trying to maintain it. We've upgraded inside and made it a little bit more friendly and inviting. But oh my gosh, I went through that in 40 seconds. Is there any questions?
Council questions, yes. Oh, we've got one from Mangum, one from, what?
Go that way first.
All right, we're going to go over here first. He's going to ask all your questions again, probably. Councilmember
Yes.
Nichols.
I just have one question.
Yes.
I noticed on your itemization of expenses here, you have repairs and maintenance of $31,000. That's like your biggest expense. What is that all about?
I know. Well, what we did, we had a couple of units, refrigeration units, We replaced them inside. So our city with the contract is for 20 years, and we take care of all the repairs inside. So we have a cushion of money, so we can take care of those repairs. We had, as far as I can recall, we're maintaining the units on top. We redid some stuff mainly it was in the kitchen, but it's not cheap.
So maintenance is a big issue for you?
It is.
All right.
But as our contract says, we take care of everything inside the building, and so we've got a little cushion for that.
Right, I understand. Okay, thank you.
Yeah, you're welcome.
Councilmember Mangum?
You had mentioned feeding seniors.
Yes.
And is there any partnership with you and Sika? I don't know if this is the proper time to ask that kind of a question.
No, that's a
but
good
is there
question
any-
because I was just thinking I'm going after Sika. Sika feeds seniors at home. We're feeding seniors, and we're trying to keep seniors independent and healthy at home. So as far as funding goes, no, but we do have a partnership with them as far as we have a lot of recipients over there at Sika that live in the housing unit that come over. A senior can essentially come in and eat for free, 60 years and older.
Yes, ma'am.
Yeah.
Other questions? Councilwoman Lurick.
I just wanted to clarify in my mind.
Yeah.
When you were talking about the units that needed replacing and that we helped with those, that was CDBG money, right? Not this funding. Is that correct? Because I know you received both.
We did receive CDBG money, but that was for meals. That was not for the unit. We paid for the unit ourselves.
Okay.
Every time we've applied for CDBG money, it's either been for staff time or nutrition meals buying food. Yeah.
Okay. So this request is, I'm just sort of clarifying this point in my mind. This is separate from any CDBG
Yes,
request
this is
that you
separate from
have.
CDBG. So our annual contribution to the city is 35K, Bonnie? 35K, and we surely appreciate that. We wouldn't be able to keep the doors open if the city, Bannock, and the city of Chubbuck didn't contribute. So in addition, I do apply for CDBG money.
Okay.
Not often, but I do, yeah.
When there's some specific.
Yeah, and we try not to
needs
do it
or
every year.
project.
We try to share the pot. We've been pretty good as far as our finances go. We're pretty set as far as if there was, we have enough money in our reserve that we could feed seniors for 2 years without any assistance.
Thank you. Any other questions? Okay, thank you, Anita.
Thank you.
Next is our Sister City Foundation, Iwamazawa. Did I say that right, Mayor?
Iwamazawa. I think you got it right.
My name's Doug Woolley. I've been involved with the Sister City for probably 10 years or so. We are a youth program here in Pocatello and Bannock County. The Sister City program was started back in late 40s, early 50s. It has three arms. There's humanitarian, friendship, and business development. And we are part of the friendship arm. And how the program works is we have a sister city that is Iwamizawa, Japan, which is on the northern island of Japan, which is called Hokkaido. And we send youth delegations to Iwamizawa, and they send youth delegations here to Pocatello. And that's done once a year, and usually it's about a two-week stay. And while they're here, we show them the area and we interact with them, and it's a way of creating understanding between basically two countries. That's what it was really set up for. It was a program that try to foster understanding amongst the different cultures and people. We typically, as it says up here, we're promoting peace through mutual respect, understanding, and cooperation, one individual, one community at a time. But primarily, it is a youth program, and it is a life-changing experience for most of the youth that go with us, and all the youth. And how it changes them is simply they have an opportunity to go over and experience this different culture and these different ways of thinking, and they come back changed. They prepare all year, pretty much. We usually pick the delegation in the fall, late fall, and then we meet once a week, and they learn the language and are coached on what they shouldn't do and should do. And then eventually, usually the end of June or 1st of July, they get on a plane and go over there and experience. And they have host families. And these host families will host them in their home, which is a big, huge part of the program, because that really, anybody that's gone will say that that's the biggest part of it, is being able to be immersed into a home that, of these Japanese peoples that we've associated with. And typically, it's an organization that fosters relationships not only between youth delegation and youth of each cities. It also fosters a lot of adult relationships with Iwamizawa and the mayor there and the mayor here, of course, and anybody that's been involved with the program. And it's we do a adult delegation too every 5 years, and so not just a youth organization, but primarily it is, and the adult delegation usually goes, and the people that are involved in the program have fostered a lot of relationships with the sister city as a friendship base. If we could go to that next slide, that'd be great. The program requires about $30,000 a year to operate. Most of that money comes from youth delegation fundraising. They do their own fundraising, and in various ways. They can do individual fundraising, and we do have sponsored fundraisings as well that we put together as a delegation or as a board. And we have a chaperone who is voted in, and they're in charge basically of a lot of the fundraising, although the board does participate in the fundraising. And the youth, usually they have to come up with, this year it's a little bit more expensive because of travel increase. I think it was about $2,500 for plane tickets over to Japan. And then they have their other expenses that if they want to buy souvenirs or whatever, but just for them to get there and for us to be able to manage getting over there, that's what it costs. I think that's the only slide we got, isn't it? Or we got more slides? No, that's the only slide we've got. The city covers about 50% of the cost of the visiting Japanese delegation. When we get the delegation here, which is usually end of July, 1st of August, the money that has been requested, I think we requested about $2,500, was it? I thought it was $3,000, but okay, $2,500. And we usually use that money to send the chaperone to Japan with the youth, and to also use as funding for the delegation coming here. We do our own fundraising to try and raise more money for the delegation coming here. And we typically will show them, around the area. We'll take them to ISU, we'll take them to a high school. We usually run them up to Yellowstone for a couple days just to show them the area and the culture of the area. And once again, I'll put this program up against any youth program out there. It is one of the best I've been involved with. And again, life-changing. And the Japanese kids that come and they stay in our homes, it's a very educational experience for everyone. And I've had Japanese kids in my home, and I've been over to Japan and been in Japanese homes, or a home once, and it's a fantastic program. And we appreciate so much the support that Pocatello City gives us. Appreciate it. And we hope to continue this relationship with the city and foster relationships with the city of Iwamizawa. I think that's about all I have. Any questions?
Questions, council? Linda?
Yes. First of all, as a cultural historian myself, I love this program and I appreciate the value of it. My question is really just curiosity. You said the adult delegation or trip is every 5 years. When is the next one coming up? Do you know?
I think it's in a couple of years.
In a couple of years?
Yeah, I think we have a youth delegation next year. I think,
It's 2025.
is it
We
25?
were supposed to go 2020, and that got canceled because of COVID. So we actually haven't had an adult delegation in almost 10 years. But
Yeah, it's been
I
a
think
while.
2025
Yeah.
is.
The next.
I didn't introduce, this is Jody McHugh. She's actually the president of the organization right now, I'm sorry. But yes, I think it's 2025, we have a adult delegation going. And if people are interested in doing that, there is a process that you go through, but just be aware that people that are involved in the program, it tends to fill up quick, is what I'm saying for that. But for the youth delegation, we've been fortunate where we've been able to send 10 to 12 Pocatello kids every year for the past, at least when I've been involved with the program. And it's typically, they fill out an application and then they are interviewed and we decide from there who's going and who isn't going. So, but most of the time, most of the kids get in, and if they don't, then they get in the next year, that kind of thing, but we did have to turn kids away during COVID. I think this is the first delegation we've got going since COVID. And
But it is open to anyone to apply?
oh, yeah.
Okay.
Yeah, it is. It is. We love to have anyone that I will say that the adult delegation is not something that we fund. That's something that the adults have to fund their own trip to Japan. So that's not coming out of the funds that you provide for us. And so.
Other questions, council? Okay.
Okay,
Thank
great.
you, Doug.
Thank you.
Next, we have Visit Pocatello, Jeff.
Morning, Council. Thank you for taking the time to meet with us. Got myself and Peter Pruitt here. I did bring some handouts, I'm sorry to say. They are more to take with you for informational purposes than for the presentation itself.
Thank you. Yeah, thanks.
Yes.
So tourism in Idaho is a $4.8 billion industry. $308 million of that every year comes to Pocatello. That is 6% of the total state tourism funding or spending. I'd definitely like to increase that number. So, first slide there. Our purpose is to steadily increase local business revenue through tourism marketing and event sponsorships. Additionally, we want to ensure that information related to our events and tourism assets are easily located and accessible, creating a better experience for our guests overall. This is a list of, basically a general list of what we currently do. So we operate the Visitor Center on South 5th. We operate the Visit Pocatello website, which I would encourage everybody to take a look at. It's very well done. We do a lot of print advertising, which you will see some examples of in the back few pages of what I handed out. So we advertise in all kinds of media, but our print advertising, we target a lot of Salt Lake City and Yellowstone travelers. We're expanding to Boise, Idaho Falls, Rexburg, and those areas as well. We do a lot of digital ads, which of course in this day and age is a massive part of advertising. When I first started this, it was about 50-50 digital and print. Now it's about 85% digital and 15% print. But we do that through all different avenues. We do a monthly newsletter. We also have a social media presence out there through Instagram and Facebook. We have billboards. Currently we have one. We had 2 last year. We're actually looking for 3 in the long run is our total goal. One coming from the south, one coming from the north, and one coming from Boise. We do familiarization tours. So we work with other entities and we bring people in to experience our area so they will go back and write articles and blogs and those kind of things about our area. We sponsor a lot of events. This year we're sponsoring wrestling, Pocatello Downs, Simplot Games, bicycling events, including Grand Fondo, Pocatello, and a few others. The Pocatello Marathon, Cornhole at the MEC, the Veterans Powwow, the Idaho High School Rodeo, and the Senior Games. We also attend trade shows. There are many trade shows out there for tourism and destination marketing. And we attend, right now I've got 6 of them on the list for this year. We also create assets. So last weekend we had a film crew in town filming just about everywhere. We create assets and we use those for our advertising. And so the grant program itself, we are funded through, or the basis of our funding comes from the Idaho Travel Council grant program. There are 7 regions in Idaho. We are Region 5. Region 5 has 3 grantees. That is us, Southeast Idaho High Country, who is based out of Lava Hot Springs, and Bear Lake. So the state collects a 2% lodging tax throughout the state. 55% of that returns in state operations, or to operate the state tourism side, and 45% of that returns to the grantees. The marketing grant is intended for marketing with an overnight stay component and must be spent 50 miles out of the area. So the grant does not provide for any local spending or employees. Community buy-in and match is a requirement of the Idaho Travel Council grant. Last year we received $232,000. This year we have requested $295,000 from the state. That will be awarded actually at the end of July. Our goals overall, we want to bring the community together through tourism, working towards a common regional goal. We're establishing partnerships and working on citywide initiatives. Our partnerships currently are with the Mountain View Event Center, the City of Pocatello, the City of Chubbuck, Historic Downtown, Chamber of Commerce, Shoshone-Bannock Hotel and Casino. We have many other partnerships out there, the Zoo, Natural History Museum, a lot of others, but these are kind of marketing partnerships that we've put together on the side as a source of funding as well for local dollars. The next 3 I'd like to attack are Pebble Creek, ISU, and Bannock County. We've created a city play pass. So our city play pass is a 1-ticket buys all to get you access to all of our tourism assets. It gets you access to Ross Park, Zoo Idaho, Museum of Clean, Natural History Museum, Bannock County Museums. It's a pass that works until September 4th and has 5 entities. So I've talked to multiple people that will come in, they'll be here for 2 or 3 days, they'll hit 2 of those entities, they'll come back in August to hit the other 2 or 3 that they missed. So it definitely encourages repeat trips and repeat visits. Sales so far this year are booming compared to the last 2. In the first 2 weeks this year, we've actually almost met what we sold as a total last year. But I will say we're pushing it quite a bit harder than we were out there doing it last year. And the digital assets for all to share. So we're going to work on creating a cloud where everybody can upload and put their digital assets. What I mean by everybody is the county will go out and pay for somebody to come out and do shots. Historic downtown will have events. They'll come out for a photographer to pay for events or photography. The city of Chubbuck will pay for photography for X, Y, and Z. We want to put all those and house them all on one specific spot where everybody can have access to them. No charge, anything of that nature, but hey, here's a pool of pictures. And that's a big piece for our community. Included with those assets, I'd like to see all the layouts for every building that we could possibly rent and use. So we should have specs in there for the event centers at ISU and for everything we're doing up at Bannock County, the Purpose building downtown. You know, we should have assets in there for everybody. We're also working hard with the restaurants and hotels to partnership. We had a restaurant hotel meeting 2 weeks ago. Hotels are very much in. The restaurants, unfortunately, we're trying to get them to understand the buy-in and the impact on tourism. And when you do look at the tourism numbers, it's kind of interesting that everybody always presumes that accommodations in hotels are the #1 beneficiary of tourism. Well, through the state, the accommodations were $974 million, and food services were $1.3 billion. So we're actually third in hotels after gas and food. So we want them to understand and be a part. We want them to represent. So we're doing things like horsemen's rates. So for example, if you're coming into town with a horse event, that could be dressage, it could be rodeo, it could be Pocatello Downs. The hotels have created a rate for us for horsemen's rates. So we're trying to make it easier on our events as well. We've also created a CVB rate, and we're working right now on a biker's rate. So anybody who's coming into town with any kind of bicycle associated event, which there are many, we would have a rate for them at the hotels.
What does CVB stand for?
I'm sorry, Convention and Visitors Bureau.
Oh, of course. Okay.
Yes, ma'am. Down the road, we want to provide communication between entities. We want to coordinate on trade shows, calendars, and events. And what we mean by that is I've been to plenty of trade shows where we have a booth. Somebody else has a booth right next to us that could be partnering with us. Shoshone Bannock Hotel, the City of Lava. I was at one year where High Country, which is based out of Lava, had a booth, and 2 down, the Chamber of Commerce from Lava had one. So if we can put all those entities together and have one good representation, that's one of our goals, is to create a calendar for events and trade shows that we're attending so everybody knows what everybody else is doing. I know it's a long shot, but down the road it'd be really nice for the county to say, hey, there's a big event out at Showband this weekend. Let's do it next weekend. The car show downtown is on Saturday. Let's have a concert on Saturday night as well so we can get more people into town to hit more things, not just random, but actually looking at what others are doing to make a better experience for our guests. I'd like to target high school events. So we want to look at all those high school finals. Right now we get a few of them, but there's a lot of them out there, and I think we're missing out on a few. I'm going to be heading to a small market meetings event. So we're going to be looking for those meetings that are 30 to 60 people to start. We don't have a big convention center right here, but we can use the Purpose building. We can use the alumni centers. We can use the wellness complex. There are a lot of assets. But I think we need to start with those smaller market meetings. I want to be a coordinator for current events. We want to help smooth successful experiences. So high school rodeo that was just here, we kind of put Kelly and George and the group together, with some restaurants, and we helped them out with some hotels, and we did some sponsorships. So I'd like to be kind of a middleman to make sure everybody's running smooth. We're going to find some new events. There's a BMX ribbon cutting this afternoon. I think one of our goals is about 3 years from now, we'd like to have some national BMX events, which will bring quite a bit of people into town. Sports tournaments, we're definitely a sports community. Soccer, lacrosse, volleyball, baseball, softball. We have a lot of venues from Coton Park to the Wellness Complex. Everybody's got them. So we want our weekends full of that. The MEC is building some beautiful new facilities that we can have indoor winter sports events. We're very excited about that. As well as things like Western Regional Wrestling, which left us about 3 years ago and now is in Farmington, Utah. So I've already reached out to them, and next time that they present, we want to be there to present to make sure that we can try and get events like that back. Frisbee golf. Outside the Visitor Center, Frisbee golf is outside my window, and I can't tell you how many people Frisbee golf. I would definitely like to create a Frisbee golf event. Out of time, but again, the hub for the assets, trade shows, the Visitor Center. I think that can be a hub down the road. It's kind of been ignored for the last many years. I went in there, I took 4 loads to the dump. There was a lot of stuff in there. It's been storage. It's a big brochure rack. I think down the road we can make it something a little bit more where people are stopping at the visitor center and actually using that as that information source. We're looking at 3D kind of more stuff. So Peter's going to give me a nice skull head to put on the wall. Leaf at the museum is going to do a buzzsaw shark that's going to come off the wall. The Butterfly Haven's making us a little butterfly exhibit. So rather than walking in to see a bunch of brochures, I'd like to be a little more interactive. We're going to get some digital displays in there and make it a hub. Electric car charging stations and those kind of things down the road there as well.
Super. Super. Thank you.
You're welcome.
Questions? Councilmember Nichols?
Could you roll up to the previous slide, please? So under partnerships there, you say Bannock County down the road. Does Bannock County currently contribute anything to you?
No, but I have met with Scott over at Bannock County, and we'd like to get in on the next budget round. I mean, realistically, they have a lot of events going on over there and a lot of assets to sell, and we need to be involved just because it's a big draw. But no, currently they are not. We're working on that, sir.
Okay, I mean, do you work with the event center and the wellness complex? And
A little bit. We're trying. We're trying to work with them. We'd love. Yes, I met with them last week. We've cracked the door. It's not an easy door to get into. I hate to say it. It's been the most challenging.
But aren't you a perfect fit?
Absolutely, absolutely. So we're trying, and I'd like to think that they will be on board as a partner next time we have this conversation.
Okay, very good. Thank you.
Take Brent with you.
Oh, good. I'd love to.
Any other questions for Jeff? Thank you, Jeff.
Thank you.
Appreciate it.
That was easy. Have a great day, guys.
Thank you. All right, before we move on to agenda item number 3, we've been here for almost 2 hours. We're going to go ahead and take a small break, and then we'll get to agenda item number 3. Good morning, and thank you for joining us after the break that we just had. We'll go ahead and move on to agenda item number 3 is Legal Department. Jared Johnson, City Attorney, and Andrea Henderson, Risk Manager, will give a presentation.
Good morning, Mayor and Council. Thank you for having us. We are here to talk about our FY24 budget. We're going to keep this really short and simple. What you see before you is last year's and next year's planned exempt, non-exempt, and total employees in the legal department. As you can see, we went down half of an employee in the exempt category. That is due to some restructuring when Ann Butler took the Parks and Rec Director position. She was the risk manager. The mayor has appointed Andrea as the new risk manager, and she was the deputy risk manager with some restructuring with the risk department, legal, and HR. We are not going to have a deputy risk manager anymore. She will just handle all of those functions. And so that saves us half of an FTE in the legal department. It also saves half an FTE in the former risk budget. So we're excited about that change. I think that'll be good for all 3 departments involved.
Jared, we got a question.
Yeah.
Sorry to take away.
No.
Is that adequate to not have the deputy? Because we had the deputy before, and obviously she's here, she was here, and still here.
Yeah.
So there was function there and is adequate at the moment. But now that we're doing away with that, is it still adequate to not have the deputy?
Great question, and I can let Andrea answer that a little bit, but I'll throw in my 2 cents. I think it is, because the risk manager before was doing risk duties as well as some HR duties, and Andrea was doing risk duties and some legal duties. She'll still continue to be part of the legal department and do a lot of those legal duties, but some of the duties she had been doing will shift to some other people in the legal department, and HR will pick up those HR duties. So I think with that shift in function, yes, one risk manager doing all the risk functions, I think is adequate. Do you have anything to add to that?
I'll let you know if it's not.
Exactly.
Thank you.
Yeah. Any other questions? Okay, then this is where we are with last year's lines and this year's lines with the 3% increase to operations. It's just a minor increase. We're very small budget compared to the other departments. Those increases, we looked at really every line in our budget and made slight adjustments to each of them. The biggest adjustment was probably in our travel and training. A lot less options in webinar and Zoom format that we've had in the few years before that, which we enjoyed. It saved us a lot of money, but we still need that ongoing continuing legal education for all of our attorneys, and so we're asking for a little bit more in that line. That's most of our 3% increase. The transfers and interfund, you can see is a fairly big jump. We're still working with finance to fine tune those numbers, but that's what we're looking at for a total operating expense of a little over $1 million.
Scott,
So
Councilmember Marchand.
in that line, that's money that you're paying to other departments, is that right? Or is
That's
that
correct.
And what do you pay for?
So we pay the interfund charges like any other department to the other departments that are interfund receiving departments, like HR, finance, IT, mayor and council. I don't think we pay ourselves, maybe we do, but then it comes back to us and it's part of our operating budget. So we're one of those 5 that receive those from all the other departments, and we pay to the other 4 as well.
But those will be lined out, right? Will we be able to see those as this budget comes, what they're paying and to who and why?
Yes, we can do that.
Okay.
As was asked for some departments that are using or that have overtime but are not using that overtime budget, our amount is very small. We're receiving a little over $2,000 in overtime. Over the last several years, we haven't used any. Our 4-year average is $4, but we did use, our 3-year average is $4. We did use $12 in 2020. In discussions with HR, it was their recommendation that we keep this $2,000, and we could reduce that. I don't think we want to zero it out because there are times when our non-exempt employees would have to work more than 40 hours if we had a big jury trial on a Friday or something like that. They do have the option to use comp time or overtime, but because they have that option, HR suggested that we keep some in that budget. It's pretty apparent that 2,000 is probably too much, but some amount would be good so that if that does occur, we have that backup. So that would be a decision that you would need to make regarding our budgets over time. If you wanted to keep the 2,000 there and let that roll on the off chance that we use that amount, that's fine too. But I'm really flexible there. The only thing I wouldn't suggest is zeroing it out, like I said, just because there might be a chance that that does get used or needed. And with that, that is the legal department presentation. I would love any more questions.
Councilmember Nichols.
Hi, new to the council here, so could you explain to me what the risk manager does?
Sure. I handle all of the liability claims that come in from the city, either third party or first party, which we've damaged someone else's property or alleged to have damaged someone else's property, and then any of our property that has been damaged. I also do now the work comp claims and the federally mandated drug and alcohol testing program.
Okay, and we're self-insured for some things?
For workers' comp,
For
yes.
workers' comp, okay. All right, thank you.
Any other questions? Okay, thank you. Then we'll move to agenda item 4. Don't go anywhere. Liability insurance, risk management, workers' comp insurance. Andrea Henderson, risk manager, will give a presentation.
So as Jared indicated with the restructure that we just did, the risk budget will now only include 1 employee. So we've reduced our FTEs by 0.5. So that will be a savings to the risk budget for personnel. Our operating budget really mostly is just insurance related. We do have some general operating costs for supplies and that kind of thing, but the majority of it is for our ICRIMP policy. This next year, 2024, we will need to transfer $6,250 from the HR budget, which had been paying for alcohol and drug testing, to the risk budget, since it will now be paying for that.
Question on that.
Yes, sir.
Is this mandatory drug testing
Yes. Federally mandated drug testing.
citywide?
Yes, for all CDL drivers. We have two different pools, the Federal Transit Authority, and then we have the Federal Motor Carrier, which is
just
for our sanitation street department.
Pick a name out of a hat and that person gets drug tested that day?
There's two
Is that-
different pools, but yeah,
Okay,
that's kind of how it
perfect.
works.
I just want, perfect, thank you.
You're welcome.
Okay.
Our interfund transfers are based on information provided by finance. So Jean will be able to hopefully answer those questions better than I. Workers' comp, interfund is the same. Things are being paid for finance, HR, IT, and then we have our self-insured fund. And some of those expenses for the operations are to pay our third-party administrator and those kinds of, and the workers' comp bills themselves. For our increases this year, it's a little bit over 3%. Our iCrimp policy is going to increase $181,000 for FY 2024. So we're going to need to fund that. That's quite a significant increase. But I think pretty much across the board, all entities are going to be paying more for insurance, so it's not just related to the city of Pocatello. We've already had the hopeful approval to increase our workers' compensation fund for the modifier by 5%, which will bring us up to 95%. And I think Ann explained in a prior meeting how that modifier works. Anybody have any questions?
Councilmember Nichols.
So is risk management now under the legal department?
It is.
But we have two different budget,
Two different funds, yes.
two different funds.
That's separate and apart from the legal department budget.
Okay, I understand now, thank you.
Any other questions? Okay. Then, thank you.
Thanks.
Then we will move to agenda item 5 is Pocatello Regional Airport. Alan Evans, Airport Manager, and Christy Hines, a Management Assistant, will give a presentation.
Well, good morning, Mayor and City Council members. Alan Evans is Airport Manager, and Christy Hines, our Administrative Assistant and our Security Coordinator, and whatever else is thrown at her on a daily basis, it seems like. I'd like to start out, our first slide, with some of the projects that we have taken on in fiscal year '23. As many of you are aware, the BLM expansion has been taking place. That started last year. Is completed, I believe, as of, we should be done this week. And so that tanker base should be open and operational and ready to go for summer work. This past year, we purchased a piece of snow removal equipment. It is a plow and broom combination, and I can just say that that particular piece of equipment was extremely helpful this last winter with keeping those runways clear and operational. We're still working on our master plan, and that should be completed, we think, this fall. That master plan, as many of you probably are aware, has to do with the aviation side. It's not the development side of the airport, but the airport infrastructure on the airfield side. We replaced a couple of HVAC units this past year, which was nice, and we'll talk a little bit more about that as we go in other slides. And then the McNabb warehouse, we did some rent abatement and allowed them to go ahead and put some improvements into one of the warehouses out there that they have been in for many, many years. And that has turned out very, very positive. It looks nice and was a very good way to increase our asset out there, if you will. For fiscal year '24, some of the things that we'd like to do, we would like to, as you can see, Air Service Conference. We believe we need to attend those. We've been, the last 2 years, I've been to Air Service Conferences, and those are things that are very vital when you're working with airlines. I think you've got to have your face in front of the airlines and let them know what your needs are and what you are looking to have done. And so we want to continue with that, and there will be a cost for the traveling to those conferences, at least one of those conferences. Air service development. This is money set aside to work with our air service consulting firm. As we look to increase services, we're going to need to have some forecasts, some route analysis, things that our air service consultant can give to us to take to the airlines to present to them. One of the things that would be included in this would be a SCASD grant, a Small Community Air Service Grant. Many years ago, we applied for one for service into Denver. If we can get our numbers back where they accommodate that, that probably is something we would be looking at again as a SCASD grant to go into another route, into another community or another major airport hub. Tenant building maintenance. As was mentioned, we would like to start a capital savings account rather than funding it every single year and trying to make things happen that way. We started out with this number somewhat because of what the McNabb building, when we did the work on that, came back as. We've got a lot of older buildings out at the airport that we've pretty much kept up to a certain standard, but it's time that we start putting a little more money into them and really sealing them up. A lot of them are leaking and having some issues with appearance. And so those are things that we would like to do, and we'd like to definitely start a savings account to do that. And then, of course, this year will be, as I said, the HVAC unit. We have one more unit that we need to replace on the terminal. Just to bring you up to speed a little bit on the things that we've done in the past, we have put new roofing on the terminal building. That probably over the last 6 years, I'm guessing, is when that probably started. And I think we've replaced probably 10 or 11 of the HVAC units, and this will be our last one. So we're looking pretty good in that part of the terminal needs anyway.
I was expecting more slides in between that, but we'll see. We haven't actually seen the full slides that are being presented today.
So revenue, you can see where our property tax is with a 3% increase. Our building leases have increased. Are we on the right one?
No, these numbers are
We have different numbers.
not right. So it looks like, I'm gonna guess that what they did was this got changed from when we sent it into an actual 3% increase. That's not how our revenue work. Our revenue is lease generated. So we know what our revenues are going to be next year based on the increases that our airport commission has approved this year based on the CPI and things like that. So our actual revenue that we get building leases, land leases, landing fees, and fuel sales. Our total without property tax is $730,222 is what it'll be for next year. It'll go up by about $26,000 over this year. So the property tax there is correct. We got $1,056,000 this year. A 3% increase would add an additional about $30,000 in there. So with the 3% increase in property tax and the actual increase in the rest of our revenue, our total revenues would be $1,818,525. The note there, $1,818,525. So the note there is that the miscellaneous at the bottom with the asterisk, we were collecting the last of our COVID stimulus grants. We got 3 grants. We were still collecting on the last one, and that was about $360,000 that we collected the current year. That will not happen next year. So that miscellaneous line is going to drop out pretty much completely, so. Sorry for the confusion there. And this one's wrong too. It's my fault, this one is, because I realized as I was looking at this last night again and preparing, I accidentally put our capital amounts in twice. I included those in the operations maintenance line, and it's also included separately at the bottom as capital improvements.
So to compare 23 to 24, I accidentally did that in both of them, so the percentage difference between the years is right. But you can see there the personnel costs, of course, and then our O&M budget. Those totals actually include the capital improvement lines that you see split out there as well. So operations, maintenance, and capital this year was $690,000. With the 3% increase next year, it would be $711,000. We have put a note there to deduct the $216,300 in revenue guarantee. That's a slide we'll get to here in a little bit. Per FAA regulations now, you cannot filter that money through the airport fund. It's going to have to go through a separate fund. So that won't be a part of the airport budget at all. Interfund transfers is the same as everyone has said previously, IT, finance, fire coverage. We pay a significant portion to fire department to cover our fire station. And then capital improvements, you'll see we did have a decrease. What we did there was we moved some of that into our O&M. The warehouse maintenance we had in capital improvements, really it's not. It's, you know, a couple $1,000s for siding and a couple $1,000s for this and that. So as we talked with finance, we realized those charges really shouldn't be in the capital line. They should be in O&M. So the capital line will be $40,000 and the remainder of that was moved into our maintenance line items for warehousing, building maintenance. So you can see adjusted for the MRG there what our actual budgets are without that MRG money. And this one has a lot on it. This is line items that we identified we believe we will need more than 3% increase in. Go through them real quickly here. Gas and oil, of course, that cost has gone up. You can see our current year's budget as well as what the 3% increase is. The third column is the amount above 3%. So that's a percentage increase as well as the dollar amounts. You have the total. And then what we're requesting our total budget is for that line item for next year. Gas and oil was a significant job. Building materials, that is part of the warehouse repairs, building repairs, things like that. Painting is for air-filled paint. We have to keep up those markings and as well as painting buildings. Equipment is our large equipment, snow plows, things like that. It's repairs to those. Consulting is that air service consulting that Alan mentioned in one of the previous slides. That's for the air service conference and prep materials for route analysis, things like that if we go after a different route. The 52 lines, equipment is when we have to pay someone else to repair the large equipment. The 3307 equipment line is for supplies for our people to do repairs themselves. So the 5204 needs an increase as well. Tires, that's tires, very self-explanatory, and natural gas is the other. We came up with these amounts based on history. Historically, these line items have always been overspent, as well as the jump in costs of it all that we've just seen over the last year. So one note there at the bottom, the $26,759 of this is covered with that move from capital. We did have $65,000 in capital. We moved it down to 40. The 3% increase accounts for that $1,759 difference. It would have been from 65 to 66 this year. 26 of that we moved and only left 40 in capital. So we're covering 26 of this already. So that leaves about 23-ish thousand, just over 23,000 additional that we actually need. It's probably more confusing than I meant it to be. But.
Okay, and that's the capital projects and equipment. Obviously, we want to start a fund and put $50,000 away to start paying for some of these improvements and repairs that we need to make in our infrastructure out there.
We're suggesting $50,000 a year. We actually have 40 already in it, as we mentioned, that's in the capital fund. So we could start with 40 this year. We could put an extra 10 in, but 40 is what's already budgeted and programmed in there for this year.
Fund 072 revenue. This is the grant funding. You can see the numbers from our passenger facility charge, our federal grants, what we'll be anticipating and what's come in. There's $200,000 from state grant. This is one of the first times that we've gotten, more than $30,000 or $35,000 from the state. They gave us 200 with some of the money that they freed up over in Boise, and so that was a welcome to receive that money as well. And then, and there is some additional, but we'll talk a little bit about that in a moment. And then the BLM reimbursement, that is the money coming in and going out for that BLM project.
So this 072 fund, if you don't remember, really is an in and out. It's our airfield construction projects. It's grant funded, and then the match is funded with those PFCs. So it's in and out just for the construction projects. So the expenditures shows you that we get it in and then we expend out on those projects. We're gonna do some apron pavement maintenance this year. The terminal access road, we're gonna start designing a rehab of that, parking lot maintenance, and then finish up of the BLM project.
Yeah, good projects that are needed. Other expenses. As many of you are aware, we've been paying a revenue guarantee, and we probably will continue to do that in this next upcoming year. We estimate that to be $1.5 million to $1.7 million. We are unsure exactly what that number will be. We have not been given that yet. As was mentioned, it cannot go through airport funds. The airport cannot pay that. That has to be paid in another direction. The second little bullet point there, I will just say, keep in mind, and I think all of you are aware of this, if we lose commercial air service, then we lose that $1 million a year grant funding, and it drops down to, $150,000. So we would still be about $850,000 short if we lose that service. So we definitely do not want to do that. It doesn't mean that we'd be doing $850,000 worth of projects every year, but we definitely would need to throw money at it on the city side to try to keep that airport up. We are on the hook to do that as we have taken grant funding over the years and need to maintain that facility. And then, of course, commercial service is a top request of businesses looking to locate here. I think each time that Mia Kate or anybody that works on development talks to these outside companies, that is one of the things that they are very interested in is, can their people get to Pocatello, commercial flights and things of that nature to get in and out both. So we want to do that. I guess I had mentioned that there was some additional state monies available. We were just informed last week, we have not gotten the paperwork, but it looks like the state is going to be giving us an additional $585,000. We believe that will help with our match on the runway project that we all know is coming up in 2027. We're going to need to have a fair amount of match money for that particular project, as it will be probably in excess, right around $15 million or more, depending on where construction costs are when that takes place. So we will gladly accept that money from the state and plan on using it in that way, which may allow us to free up some of our monies and operate on reserves once again.
So that's an option we would like to put in front of you for funding whatever a revenue guarantee might be. In looking at our excess reserves, we had been saving for this match for the runway project because we're going to need at least $1 million in match. And as you can see, we were collecting 36 to 50,000 in PFCs. That's not going to match $1 million. So we had made sure and built up our reserves so we'd have that match. Now that we have possibly, it looks like 785,000 from the state, as well as what we've built up in our PFCs thus far, we believe we can match that. So an option for funding the revenue guarantee again in '24 would be the same as we have done before. We could offer up our tax support for that year that the city could then use as the revenue guarantee, and we would one time again take that $1 million out of our reserves to operate on, knowing that we've got the state money now that can be used as a match for the runway project. That's only $1 million. We don't know where the revenue guarantee will end up. We're going to be talking with Delta. They said within the next few weeks they should come to us and we can begin discussions and see what that might look like.
Super. Brent.
Yeah.
So bottom line, what's the total dollar increase you're requesting from last year?
Well, I don't know because it looks like our personnel slides did not get put in here. Nope, they didn't. So from what I saw, we are actually able to fund our 3% and our over 3% increases with our increase in revenue. So it's personnel costs is really where the shortfall is. And I believe with the personnel costs in there, it's about 154,000 that our revenue will not cover. So we would need an additional 154,000.
So that's based on, what was it last year?
So last year, our total expenses were, yes, I did this last night and made horrible scribbles, so let me read my writing one time here. This was minus, if we take that 210,000 MRG out, I'd like to keep that out because it's not a normal operating budget. Well, see, I don't have personnel on here because I never.
I'm just trying to get to the bottom line.
Yeah,
You know?
so our total budget, including personnel costs for the year would be, for '24, would be $1,972,750.
So bottom line, you're looking for about $154,000 more than last year? Off of about $1.9 million? Okay, all right, thank you.
Yes.
Okay, other questions? Okay,
And we are not requesting any personnel changes.
No.
It's not on here. We've got 4, 8, 11 employees. And we did have some of our overtime budget that we thought we could give. I don't have that number in front of me. It was like $7,000, I think, that we felt we could reduce our overtime budget. You never know with winter how it's gonna go, but even taking the heaviest winters out of the last 5, we felt that we could reduce that by about 7,000, I think is what it was.
super. Thank you.
Thank you.
Then we'll move to Pocatello Regional Transit. Skylar Beebe, Pocatello Regional Transit Director, will be present to give a presentation.
Mayor and Council, good morning. Skylar Beebe, the Public Transit Director, or you can refer to me as Grandpa Beebe, as my sisters are currently with my back issues, so. For the Public Transit Department, for projects completed in fiscal year '23, we have our ITS project, which is currently being implemented. We anticipate it being finished by September of this year. This is replacing all of our dispatching software, the computers that are in the buses and so forth. And also, it'll provide information and data for our fixed route system here in Pocatello that we have not had for almost 10 years now. We originally implemented this project, the original project, over 10 years ago, and so this is completely upgrading the software and everything with that. This project was, as you may recall, was 100% funded with the CARES Act. We received a bus today, and we receive our final bus tomorrow, 4 of which that we were expecting in this fiscal year. So we're very excited for that. We have some very old buses and tired buses on the road. And this is for our 1 bus that will be in our rural program and 3 that are here in our urban program. Also, last year, this was an expense from last year, but I just wanted to highlight it because this was for bus stop signs, I should say. If you've seen any of our signs around town, they've looked very sad and faded. We were able to amend a grant this last year that was able to purchase all these new signs, and so it'll be a huge improvement for the community as far as visual and our patrons. For fiscal year '24, we also, as you may recall, the coach that we had received in fiscal year '22 was the first of which we'd received in about 16 years of a new coach. And so with council's approval we had amended this for the fiscal 23 budget, so it was in this year's budget for buses. This will be one that will be delivered sometime in 2024. We're just preparing to put the bid out. And again, this is 100% funded with our remaining CARES Act funding from our last coach and also ARPA funding that was specific to Federal Transit Administration in our case. Also for next year, we have just over $1 million that we have programmed from grants that were approved by council and with match that we also have that we generate ourselves through our advertising. And so we are looking at 8 to 9 buses, depending on how pricing will come in, and which can be very interesting, as council is probably aware. And so the way this will equate is it's about $115,000 each in required match for our rural program and then also in our urban program. Also in fiscal year 23, we had the sidewalk project. This was budgeted this year, and it's likely looking like it will roll into next year. So that's why we've put it into there. This was funding that we received from District 6, the Idaho Falls area of 5307 urban money that they were unable to use, which we will use in the number streets here. So essentially everything kind of east of 7th Street. All the number streets that will improve curbs, sidewalks, ADA accessible ramps, accessible access to public transit bus stops, and it will be a wonderful improvement. And the match for this is covered with CBDG funds. For revenue, I indicated the flat. You'll see 3 different numbers here for the totals, and the reasons why is because in the flat section, we had removed the capital funding that we have for buses and our ITS that was budgeted for this year. So that's why you'll see a difference there. And then also into the 3% with the increases from the new capital that will be in fiscal 24 and increases in salaries. For our expenditures, we didn't quite take the full 3% for the operating. What we have done, that you'll see just a slight, and again, with these numbers here, our operating in fiscal year 23, that included our sidewalk money. And so for fiscal 24, we actually moved that over to capital. That's why you see such a large decrease in our operating there and then an increase with capital. And then with that increase, we are looking to increase our operating supplies. This is our cleaning supplies, our maintenance supplies, as well as our motor-bus repairs. With the record expenses that we've been seeing for cost of filters and so forth, that's why we are seeking that increase in that. For our capital projects, again, for fiscal year 23, I simply just listed what is actually happening for fiscal 23 and not necessarily what was budgeted. So you can see in fiscal year 23, we had the buses, the 4 buses that we are receiving today and tomorrow. And then in fiscal year 24, this is also for the light duty buses. This is the smaller, what we call cutaway buses that will be for the, and I should have mentioned, for the Fund 8, that is for our rural program, and this does not, there's no city funds involved with our Fund 8 rural program, and so Fund 9 is the urban, where the city provides the match. For fiscal year 24, again, this includes our light duty buses, the heavy duty coach, as I mentioned, and also our sidewalk project. And then currently for fiscal year 26, we have small urban funding to purchase a couple smaller cutaways again in that year. For my last slide here, this is as council had requested, we are, with the recommendation of Human Resources, an increase with our overtime in our 2501. This is our door-to-door service line item here. We never quite know. We have so many part-time. We experienced an interesting trend last year as we were short-staffed. We ended up having some more overtime so that we could cover our operations. And so we were looking at the 3.5% increase for that line. And then also for our 2401 line, this is our drivers for our fixed route mode. And again, this is where most of our part-time employees are working. You'll see the 14.5% decrease, and that might look a little weird. And the reason why, this is in our rural fund, 2601. This is our drivers on that side. The reason why we're seeking the decrease is because in the last couple of years, we've added a couple full-time employees. And so with full-time, we now have less need for part-time. And so those numbers have gone down, and hence why we're seeking the decrease of 14.5%. And with that, that concludes my presentation, unless there's any questions.
Brent?
So again, bottom line, you're looking for a 3% increase over last year?
Correct.
Okay, thank you.
Any other questions? Okay, thank you.
Thank you.
Then we will move to agenda item 7, Marshall Public Library. Eric Cease, Library Director, will be present to give a presentation.
Hi. Good morning, Mayor, Council. I think the budget's fairly simple. We're looking at completed projects for '23. We have really worked on trying to increase the purchase of our ebooks. As a note, we've purchased 6,142 items. That's material. Now we have access to over 22,000 items. Programming is also increased to above COVID levels. We now have 725 people a month going to programs on average. And we've been utilizing volunteers for a variety of beautification projects and things around the library. And I cite a couple examples of some scouting eagle projects that did some things for our landscaping and also beautified the front area of our central garden area at no cost to us. So that's been really nice to see done. For '24, fairly simple. We'd really like an elevator. It's really critical, and in fact, it's not a want, it's a need. At this point, I know that Schuyler has received several requests with ADA stuff related to it, and we can't keep not having an elevator. So the cost actually at this point is $104,000. The difference between the $90,000 that we had before, $94,000, and now is that the original estimate was apparently based on a one column elevator, and we actually have a 2-column elevator. And so that is a difference in the cost. The other thing that we're going to be doing within the library is an expansion of the children's area, and that's being done by a gift by a local family who lost a loved one, and whose family has chosen to donate an initial donation of $50,000 to increase the capability and the size of our children's programming area. They've also indicated that as needed, they might have other access to more funds to keep that going and make sure that we're doing that right and doing it well. So that's highly, highly appreciated.
Eric, we have a question.
Yes.
With that donation, were there any specific stipulations to enhancements in the children's area?
We talked about it with them. Again, it's a family. And specifically, we're looking at, they wanted to have programming, children's programming related issues. And so things like STEAM activities, the science, technology, engineering, arts, and math, wanted to be dedicated to that, and also to increase the actual physical presence of the room. So the children's programming room is going to be expanded. We're working with contractors, or trying to get contractor response right now. Our hope is that we can start that sometime in the fall and finish it sometime in the spring. But as we need additional funds, they've indicated that they are certainly want to try to make sure that's covered. But they wanted to do it with children's because that's what they remember the library as growing up, as it was really, excuse me, really important to them, and they want to continue to expand that. So it was not very specific conditional, but in general, they wanted it earmarked toward children's activities.
Thank you.
Going into personnel, there's no change. I think we had a W instead of a 2 over there, but anyway, we are still at the exact same number of people. That's no change and no requested change. Revenues, we really, the numbers there are what we get primarily through property tax. We had some small amounts that come through fines and fees, but that's a very minimal amount. Expenditures, personnel continues to be the highest portion of what we do. And I think that we've got, is it still the same number? Two, is it? Yep. Yep. And essentially, we are not looking for anything over the 3%. We're looking for really anything increasing at all is really primarily driven toward the increasing cost of electronic materials, and then also supplies and maintenance, building maintenance costs. That's primarily where that increase is. But we're not asking for anything over the 3%. And then the capital projects, again, that's the elevator. That's the 104,000 that we're looking at. Once that money has been dedicated, however we find that and wherever we get that from, it's still a 6-month timeline out before they can start the project. So once that money is, we have a half down, essentially, then they can sign the project, and they're still looking at 6 months out before the elevator can be fixed. So that's all I've got.
Questions for Eric? Looks like we have one, Linda.
Just a quick question about the vehicle, the long-awaited vehicle that you did get.
Yes.
Is that working well?
Oh, it's beautiful. Yeah, we're able to get around to a lot of different places, either through programs in the parks or various other locations throughout the city. Again, that came to us through a state grant, and so we didn't pay for that out of the city budget.
Okay. And I appreciate the emphasis on increased programming. I hear a lot of good things in the community and the e-materials, that kind of thing. And congratulations on that very unexpected, wonderful grant, or not grant, donation, sorry.
Well, he came to us and said he'd like to give us a little money, and Trina and I sat down with him, and we were thinking, 500 or 1,000 or something like that, and he said, well, I'd like to start with about 50,000, and we both kind of, oh, okay. But we really appreciate it, and it's going to make a really huge difference in what we can offer to the children.
Absolutely. Okay, super. Okay, thank you, Eric. Then we'll move to agenda item 8, Animal Services. Chris Abbott, Animal Service Director, will be present to give a presentation.
Good morning, Mr. Mayor, Council. I'm Chris Abbott, Director of Department of Animal Services.
You got control of that?
No, Gene's supposed to. Oh, okay. Good morning. Animal Services completed projects for FY23. We did quite a few in 2023, and some we're still working on. We set up a virtual shelter map, which helps improve animal management and inventory. It's helped out the front counter staff a lot when they need to look up animals, especially stray animals that come in. It gives them a better idea what's back there in our inventory. We just recently acquired a transport van that was given us by the police department, and this is going to provide ability to transport animals to events and also provides us with a backup vehicle. We've only had one vehicle in the last couple of years, and it's getting kind of worn out, but we want something that we have a backup for when that van goes down, or when that vehicle goes down. We just recently designed and built a grooming room. We had a little area off the side of the kennel that wasn't being utilized. This is going to help the employees and the volunteers to help groom animals. It also provides an area for the local police department, the canine units, to wash their animals as well. Enrichment room and play yards. The enrichment room is to help socialize the animals. It gets them out into a quiet place. Staff will take animals that are stressed out, go in there, work with them. They have enrichment tools. And the play yards for play groups. Gets them out, socialize. Animals that are exercise regularly and aren't stuck in a kennel all day adopt very well. So we like to pride ourselves in this enrichment. New kennel doors and repairs. This has kind of been an ongoing situation for the last few years. We finally got a maintenance man. We had all the kennel doors purchased. We just didn't have a way to install them. So we have a maintenance guy now that's installing them. He actually completed them. A lot of those doors are 6, 7 years old, so the dogs are chewing on them. So now they're all brand new and all in working order. Objectives and outcomes for 2024. Out in our play yard, we have a chain link fence, and we're going to put up a kennel barrier. That kennel barrier there will divide the play yard from the kennels. That way the animals that are out in the play yard aren't fence fighting with the ones that are out in the kennels. Gives them a little bit more privacy and keeps the animals a little bit more calmer. And that's also going to be funded by Friends of the Pocatello Animal Shelter for that project. The van, we're going to put a wrap on it, advertise the shelter. That also will be paid by Friends for the advertisement for that wrap. This is a big one, chain link tops for indoor-outdoor kennels. Some of the kennels there have tops on them, but we're getting increasingly more animals that can go up over the top of these kennels. So we're gonna try to get most of the kennels, if not all of them, with these chain link tops on them. Better secure the animals. Back in January, we had an issue with our heating system. When we had those drops in temperature down to the 1 degrees, we had a pipe break in one of our cinder block walls, and it froze all the dog bowls, water bowls that night when the heating system shut down. So we're looking to get a backup system, so when it reaches down to a certain temperature, that backup system will kick on and at least keep those kennels warm and the animals warm throughout the night. And shade awning for the center play yard. There's a center area of the shelter which doesn't have any shade at all. And in the summertime, when we put animals out there, it gets extremely hot, so we can't leave them out there too long. So we're looking at getting shade awning for those center play yards. And that also will probably be provided by the funding through Friends of Pocatello Animal Shelter. And this is Jen Brown. She's our assistant manager, and she'll be going through the expenditures and expenses. Whoops. The wrong one.
Wait a minute. All right. I don't know where to. Obviously, we're just asking for the 3%. I don't even know where to start with all of it. We need lots of money, but our 3%, we were just going to try to capitalize across the board, generalize going forward until next year, because we now have the vet on board, so we don't have budget money for that salary, but I know it's still the bottom line, so we're working towards maybe trying to balance this a little more and ask for a little more money come next year. But for the moment, it's just this 3% to try to keep us level in our operating portion. Let's see here. I don't know what else to say about this one.
That 3% increase will also go to
This one's hard for me this year.
will go to mainly vet bills, our vet line, and our operating line. That's where a lot of our money comes out of, are those two things.
We've had a lot with our building repairs this year with, the wall, the heating system. So we're just going to try to maintain and then reevaluate again going forward as these changes continue to seem to happen.
Do we have a question by Councilmember Mangum?
So you had made the comment that more money was kind of needed because we've added this vet. So why are we not asking for more money since we have this vet?
Chris and I we had a discussion about it and looped Gene in, and of course, the famous saying is the bottom line. And so we have some lines where we have a lot of extra money, not a lot, but we're gonna have some excess money, so we're gonna try to see how that bottom line balances come the end of this year, having added the vet on board. And then going forward, projecting, it would be, I guess, 25's budget technically. If we need to ask for an increase to cover to make ends meet, we were gonna do it then.
So do you feel like you might run into some danger of being over budget because you're not asking for enough? Or do you think that the excess of funds which you currently have is going to cover 24?
We're gonna be real close, real close. Because again, like I said, she hasn't been on board a full year yet, but her yearly is like $70,000. And so that's basically essentially $70,000 this year that's not in our budget. But we have, I don't have that in front of me, several lines, like I said, that we've paid less than. So we're gonna be, we battled this back and forth, like how do we go forward trying to project for next year based upon our new occurrences this year. We're trying to play it somewhat safe without asking for,
I fully appreciate that, and I love the fiscal responsibility, but I don't like having that risk of being so over budget that now.
We won't be over tremendously if we end up being over, and as of right now, we're gonna be, under budget, as of right now.
Okay.
Of course, we try to project our next, what do we have, 3 months, I think, left and we never know what we're gonna incur up there. So that's kind of where our wishy-washy, like, we're not too sure what we're gonna need to spend the next 3 months. And we were trying to project, but we've had probably the biggest expenditure year, I feel like, in extras that we didn't plan on with the building material or repairs and whatnot. I'm feeling like we're gonna be pretty level.
Okay.
With the veterinarian coming on board too, hard thing what we're finding is before we were taking the animals to the vet to be spayed and neutered. So we're looking at the cost of that with the cost of our veterinarian and the supplies. We're hoping that with the veterinarian there, that'll bring that cost down and not using and contract veterinarians in the area. And the initial startup when she came out, because that facility wasn't being used for years, we had to get all the equipment maintenance. We had to get all new supplies. A lot of it expired. So a lot of that took a lot of money to get going, but I think moving forward, it'll level itself out.
So are we able to offer, because since we have the vet on now, are we able to offer that service to the community to possibly?
Right now, she's just contracted to do spays and neuters and minimal medical procedures for the shelter animals.
My last question. We have the grooming room, and it's specific to the animals who are at the shelter and the canine units. Can we offer that to the public possibly? In some situation, some regard, they provide their own shampoos and conditioners, cleaners, whatever, but it's a room for them to be able to bathe their own pets because they might not have the space at home, charge them $5 per time they visit, and that creates another revenue stream for your department.
I would consider something like that.
So
I'd
it
look
could be
into it.
done.
And what's good about where that room is, it's actually has its own entrance, so they don't have to go into the facility. They just go right around into the door, and so yeah, it could be a possibility.
Okay, Super Brent, and then Rick, and then Linda.
I'm interested in your heating system difficulties there. You'd mentioned that the heating system.
Probably take lunch before we
Yeah.
go into that. Oh, it's been a nightmare.
I'm trying to figure out, you said the heating system shut down. Did it shut down and stop and then freeze, or is it just inadequate that it's running and it just can't keep up with the cold
With
temperatures?
that, when they designed that place, they designed it to pull in fresh air from the outside.
Okay.
It doesn't
It's common.
recirculate like most, like homes do.
Okay.
My understanding, I'm not an HVAC guy, but my understanding is what's happening is that when those temperatures come down to those single digits, that cold air that's being sucked in from outside is shutting the system down. And they're saying it's a computer board that's in there that's malfunctioning. So right now they have a guy that's gonna come out and take a look and see if we need to replace those boards, if they can, or if that's just something the system's gonna do because that's the way it was designed. So right now, we're waiting to see if that specialist can come out, check out those boards, see if that's something if we can go that route, it'll be cheaper than getting a backup system at $14,000.
Right.
For additional heating. But I don't think the whole system needs to be replaced. It only happens when we get down to single digits. So a backup system, when we reach down to maybe 50, 40 degrees, and that system shuts off, the other one will shut
Or
off.
fix the
turn
fresh
off.
air, like you're
Yep.
talking about that's coming in. Okay, thank you.
And it'll help from the pipes freezing in the wall, because that's what happened in January. One of the pipes froze in the cinder block walls, and
And that was because the heating system shut down due
shut
to
down
this
in the
fresh
middle of
air
the
issue.
night. The dog bowls were frozen solid, so the animals weren't comfortable as well.
Okay, thank you.
Council President Cheatham?
I don't see any revenue numbers in what you've projected.
We, again, we kind of battled, the animal shelter, as most probably know, doesn't really bring in much revenue of any kind. I did print the numbers to verbalize if need be, and I can provide copies if need be. Let's see here, for fiscal year '22, our total revenue was $174,000, that's it. So this year, so far, I mean, with projecting, and we're only at 105,000 this year. So we don't really make any revenue, even with the increase in fees that I think Chris has proposed. It's not, we just don't bring in revenue, much of it.
So
It's
are
minimal.
adoptions off that far by a third?
What's that now?
Are adoptions then off by a third?
Adoptions have been down this year
Yes.
greatly. And we've had more increase of impounds. So, and especially in the dogs. Knock on wood, the cats have actually been pretty good. It's usually the other way around. And we're finding a lot of the shelters and rescue groups are in the same position we are. We're just overwhelmed. I checked this morning and I had 5 open kennels, 4 dogs that we leave open. We can't even take owner surrenders right now for city animals that come in as strays. So every day we try to get as many as we can to clear out one kennel and bring in another. We just recently had a half price a cat adoption, and we cleared out 12 cats that week, but in the same time we brought in 12 more. So, it's kind of like a vacuum. And we're not the only ones. We usually will try transporting, looking at other agencies, other shelters to see if they have room. But everybody right now is just, they're turning us down. So we're trying to get creative, see what we can do to get animals moved. I mean, I don't want to ever say no adoption fee promotion type thing. It's not off the table, but I don't like doing it because I don't want people to do impulse adoptions because it's free.
Thank you.
Okay. Councilwoman Lyric.
I have a question that I wanted to ask, but just related to what Rick was saying. Do you have any idea why they're down? Is it at all COVID related as we come out of the pandemic? Are
There's
people
several pieces to it that we've
The
noticed.
adoption process, Cats, we're finding the cats that are getting adopted fairly easy. It's the dogs. And I think a lot of it's because of housing. A lot of landlords now don't want pets. A lot of it is medical bills, vet bills. They're extremely expensive now. And food bills are expensive.
Yeah.
Even for my own animals, I can see it every time I go to the pet store to get pet
Yeah.
food. It just keeps going up and higher and higher and higher.
It does. I have one cat, and she's very expensive.
And I hate to say it, and I hate to say it, people are probably being a little bit more responsible by not adopting because they know they can't afford it, but that actually hurts us too. So
Right.
it's,
I mean,
it's a
it's
give and
good
take.
that they're being responsible, but yeah, there's a
Right.
downside.
But there is a downside.
My question is related to Corey's suggestion, but I walk a lot on AMI and Kirkham, and so I'm driving past the shelter on weekdays, weekends, evenings, and I just see the use of the yard, the play yard. I don't know if it's always been that busy, but it seems like there's always people out there playing. And I was wondering if that had increased, but if also you said there was an outside access, do you think that there would be use of this suggestion, like after people take their animal to play, can they just, would they be able to just access that grooming room
Yeah,
to
it's
clean up
fairly easy.
their
It's around
animals
the back
afterwards?
side over by the garage of the shelter.
Uh-huh.
But yeah, it has its own access. So it's very easy to just walk right in.
And do you think that that use of the play yard would increase the desire to use the grooming?
Yeah.
Would those
Yeah.
be tied together
I think you're
at
talking
all?
about the dog park, right? When you
Yes,
first come
yes.
up. Yes, oh yeah.
Yeah.
Just for the general public, yeah.
Yeah.
Yeah, and you can advertise for it too.
So if you advertise for it. that
Car
doesn't
wash
have
for
to-
dogs.
Yeah, when your dog's done getting dirty here, come on over.
One-stop shop, play and bath.
Just don't throttle them. No. That's a really interesting idea.
I've been
for
looking at
some
other
revenue.
streams. I mean, not a lot. I mean, there was talk about an incinerator at one time where we can do cremations and that kind of thing. Incinerators are extremely expensive. They take a lot of maintenance, and
It would not pay for
and it
itself
wouldn't
anytime
pay
in
for
the near.
itself in 50 years.
So
it's
not
kind
a
of
good
like
revenue
right.
stream.
Little things like pet tags, ID tags. We can have a machine there to do laser cutting and that kind of stuff. Some of the some of the shelters now have little gift shops to bring in some type of revenue. So it's little things like that, but animal shelters generally don't make a lot of money.
Okay. Any other questions? All right, thank you.
Thank you, sir. Thank you, council.
Ben?
Thank you, Gene.
Yes, thank you.
Let's see, then with that, we will move to agenda item 9, and I'd like to thank the council for being here today. I would like to, I forgot to do this morning, Council Member Mansfield called this morning very sick, and I asked him to stay away, and so hopefully he'll make it back, make it here tomorrow, but if not, I'll give him the same advice and have him watch the live stream tomorrow. So if you don't see him and I forget, that's why he's not here. He is not doing well at all. So with that, thank you, and we are adjourned.